I'm Lisa Kelly, co-founder and executive director of Mental Health Awareness of MHAM. I'm also a clinician and have spent 20 of the last 30 years working with the perinatal population. This symposium that we do is particularly close to my heart. So I'm always excited that we do this, and even more so today. I want to thank our sponsor, Anthem Blue Cross Blue Shield, and express appreciation for the support from the Bolinos Foundation, which allows us to provide the symposium free of charge. Also want to thank our symposium planning committee. So our planning committee, I think, is in the room, so just wave when I say your name. Renata Williams, Chaquisha Jordan, Nancy Coiro from the St. Joe County Health Department, Michelle Pellot from Healthy Families, and Kiana Jackson from Youth Service Bureau. So thank you to our committee for helping us. Also want to let you know that we're recording today's symposium, and it will be available on the MHAM YouTube channel probably in the next week. So if you know somebody who couldn't make it today, or if you want to rewatch, then we are happy to have you do that, and we'll send out the link probably to all of our registrants. So over the past year, MHAM has developed more programming to serve pregnant and postpartum families through our pro bono counseling project, our peer support, our outreach as anchor partner for the Pop-Up Pregnancy Village, and by training clinicians through our master's level internship and our maternal mental health fellowship. Finding out that you're pregnant, the reality after the baby arrives, and the devastation of losing a baby can bring intense emotions for both the mother and the father. It can bring excitement, anxiety, grief, and even terror. All of the emotions we see during this time in somebody's life. And we know that this period especially is a really important moment in a family's development. This is our third symposium where we get to take a deep dive into the issues that arise during pregnancy and the postpartum period. Last year, we received feedback, and yes, we do read comments on the evaluations, so please turn your evaluations in. That we should do something for dads. And we took that advice seriously and recognized that we do have a bias toward mothers, even within our own programming, at the exclusions of dads and partners. We're focusing on dads and partners today to allow us as a community to think about how we engage and support them. Everyone in this room is motivated to help families be successful. And today we're going to explore why it's important to support dads and partners, what is being done locally, and finally, we'll hear from 3 dads about their experiences. We're excited about the different voices that you'll hear today. So I am delighted to welcome Dr. Craig Garfield. Dr. Garfield is a professor of pediatrics and of medical social sciences at Northwestern University's Feinberg School of Medicine, and is a practicing pediatrician at the Lurie Children's Hospital of Chicago. Dr. Garfield has co-authored all 3 of the American Academy of Pediatrics statements on fathers and pediatrics, contributed evidence or to scientific evidence of the dad bod, which I'm not really sure what that is, but I'm gonna just read what you wrote, and collaborated with the CDC to create the first ever public health surveillance system for dads called CRAMS for Dads. He's honored to have recently been the 2025 Thinker in Residence at Deacon University in Melbourne, Australia, which sounds like an amazing gig to be a Thinker in Residence. But Dr. Garfield, we're so delighted that you're here, so welcome.
Morning, everyone. You can hear me okay in the back?
Yeah.
Yeah, great. And it's a big room. If you want to get more intimate, feel free to get down. If you're just coming in, kind of, you can make your way down also. How do you get that guy that guy? It's on here.
Yeah,
We'll get there. It was a really good day to be healthy today. So I'm, as Lisa said, really, I'm honored to be here. When Lisa and I were talking a while ago about this symposium, I think what impressed me most was that, first of all, you all have a way to respond to one of the biggest issues when it comes to working with men, which is you have a network of people who can you can call on to help work with those men when something is identified. I think that's one of the biggest issues for work with fathers. And the second is that we actually have a lot of good data coming in that I want to share with you. And I think symposiums like today, where you have experts from what's happening on the ground, people who are working day to day with dads, thinking about them in your community, will share their experiences. And I think I feel like my role then is to come in as a bit of a lightning rod to kind of let you guys know about what's happening on a national scene and where we are in the world of trying to understand fathers and uh, where we are today. Even this year, there's been a lot of changes. Thank you very much. So what I'm hoping to do today is to discuss the social cultural shifts in families resulting in increased father engagement. That's why we're all here, why you're asking for more information on this. Talk about the interrelationship between father well-being and the well-being of mothers and children. And then share some of the cutting edge public health research that we're lucky to be taking part of. And then at the end, identify ways to engage with fathers in a pediatric or any sort of clinical setting as you're thinking about the work that you're doing when you leave here. And I'd like to just start by telling the story. This is actually just a few miles east of here. This is me and my son. It was a while ago. He's a bit older now, and I couldn't hold him up like that. And no way, he's like in his 20s. So I show this picture because when I finished my pediatric training, and I had done that at Mass General in Boston, and my wife and I moved back here, back to Chicago, for her to start her pediatric training. And I had talked about being a parent to patients and families, but I really had not walked the walk at all. And I knew it was going to be a busy year. So I took that year off after we moved back home. I was a stay-at-home dad. So anyone know the acronym for a stay-at-home dad? SAD. Stay-at-home dad. It's just terrible. That letter's kind of high enough. But I was a stay-at-home dad for a year, and that completely blew my mind, right? Because I, as a pediatrician, would sit across from people, from moms and dads, when dads would come in to the pediatrician and talk with them, but I really didn't know what was involved in the day-to-day of caring for a baby outside of my office. So this was a really unique opportunity for me, and it ended up actually changing the whole trajectory of what I was doing. I had signed up for a research fellowship looking at injury prevention in the emergency room. And after that year at home was like, gosh, there's something going on here with dads that I want to learn more about and research. And that's kind of what led me to this whole idea of working with dads. And it actually, the timing was actually perfect for what was happening generally in society, of men wanting to be more involved with their children, women wanting to get back to the workforce, and how do we deal with that struggle within families, married or not married. And I would say all of this talk today is about married, not married. That's almost in the United States with 40% of births, so unmarried couples. I'm not so worried about that piece. It's about the relationship. And for me as a pediatrician, it's about the child. And that's really the index for me, is how do we best support that child, whatever the family constellation looks like, and how do we support those families. So it turns out, I want to put some of this in context for you all, but Madison Avenue, those advertisers really know almost better what's happening on Main Street than we do in the clinic. And so has anyone heard the word dadvertising before? It's where marketing is actually targeted towards the dads. Moms do most of the buying in couples, but this is one of the examples of an ad that I think you'll appreciate. Some of the universal themes that they really captured with this ad. And our sound is off. My AV guy still here? Give me 1 sec to see if you guys can see how good or bad my text was. Like nothing like if you can grab that AV guy, just because there's a couple of other videos that would be more important, I can just narrate this one, which is basically, it's a really beautiful video. It's done by a company that makes soap. And that seems kind of ridiculous that the soap people are actually better than the American Academy of Pediatrics in promoting the idea of how fathers can be involved. And they kind of go through this whole, all these different ways that children are, or dads are with their kids, from Halloween to dances, playing in the playground, things that when you see it, and there's a really great soundtrack with it too, you immediately identify, like, yeah, that's the way that dads are involved in their families' lives. And it just is amazing that it's captured by a soap company. And that what really makes men care is showing that he cares, right? So it's time on the ground with your child. So I want to give a little bit of context for the number of fathers to 2024 data. There's a lot of dads across the country, 72 million fathers. 24 million are living in married couples with children less than 18. 2 million single fathers are out there, and they represent about 20% of single parents. And the number of SADs, or stay-at-home dads, has been increasing slowly over the years, but they represent caring for about 400,000 children. There are a variety of fathers in families as well. While 1 in 6 fathers may not live with their child, they are still involved. I think that's really important research that's come out from the fatherhood research area. 98% of fathers who do not live with their children are involved with them to some degree. I think it's important for us to remember clinically when we're working with families that while the dad may not be living in the same house as the mom, that dad is seeing that baby or that child with some regularity. As I mentioned, 40% of births in the United States are to non-married couples, and the fathers who may not live with their children, they may be younger, they may not be married, they may be lower socioeconomic status, they may be unemployed, they themselves may have poor well-being, and there's relationship instability in those families. They tend to spend less time eating with the child, caring for the child, and playing with the child than resident fathers. But when you survey dads about how they spend their time, and this data is the most recent, but still a little bit older, and you look at how moms and dads are involved and spend their time with kids, the moms are clearly doing the lion's share of the work with the children. I think that's important to recognize and acknowledge. But the dads, when you compare on the side that says dads, from 1965 to 2016, there was an almost 3 times increase in the amount of time that dads are spending with their kid. And I think this is actually, if this were to be repeated, in COVID, that actually changed, and dads were around more because of what happened during COVID, and realized that they actually liked being involved with their kids. I mean, I'm a dad, and not always, right? No one really likes to be with their kids all the time. But the idea that, wait a second, there's another way that I could be doing this, there's another way that I could be involved, I think is what we're dealing now with society and why we have symposiums like this. When you ask about fatherhood as part of dad's identity, again, this is from Pew, it's very similar to mom. So the notion that dads and moms both value being a parent is really important. It's central to their identity. So moms and dads are essentially the same in saying that parenting is extremely important to their identity. Parenting is rewarding all the time, and saying that parenting is enjoyable all the time as well. When you then ask about why they're if they spend enough time, most dads will say that they spend too little time with their kids, and the reason why they aren't going to spend that much time with the kids is because of work obligations. So I want to just quickly, this is going to have audio too. Should we test it?
Yeah.
Okay. Yeah, so it's supposed to go through. I can hear some nods that you know that video. So we'll try and get some audio with it too. But I think one of the things we need to make sure that we're aware of are our own assumptions and biases when we come to this work of working with dads. It may be that our own dad had a different role than the dad who we're seeing across from us. It may be that this particular dad is coming in may have had some issues or run-ins with different institutions, and we bring a bias to that as well. But if you look broadly at how dads are involved in families, they want to be there. They're interested in being involved. Oftentimes, what I find as a pediatrician, and I'm often there right literally as they are becoming a dad and that baby is born, is trying to figure out how they can get involved, but they don't even know where to start oftentimes. And so what happens clinically is they're often on the side of the room, they're often on their phone. I walk in, say, to the normal newborn to see a new baby, and the dad is on their phone. And unless I engage that dad, if I only talk to the mom about how are you doing, how are you feeling, how's breastfeeding going, and I don't pull that dad away from the phone, away from not feeling like he belongs there, then I haven't done my job, right? So I think coming to this work and thinking about, as if you know this video, it's this beautiful conversation between this toddler and this dad as they just finished watching a show. And you really see this kind of serving back and forth of engaging with the dad and the dad really responding to that child, and the child just eats it up and is really there. And you know that that's going to form a great foundation for all that we know about bonding with children. That's going to form a great foundation for that relationship going forward as well. If you can get it out of the computer, then you just hold it.
Yeah, I did try that.
Okay, so thank you very much. Nice. Yeah, great. So I'm not gonna, it's such a great video. Has anyone not seen that video? Oh, man. Should we watch it?
Yeah.
Okay, okay. I love it. I just, every time I watch it, it cracks me up. So I'm gonna put this. You can kind of hear that?
Yeah.
Right, don't fight that. Like all the way out, don't make it easy, you know what I'm saying?
Obviously, there's so much going on between the two of them.
That's
It's just really beautiful. All right, so we'll go there. I want to also mention that the Surgeon General put out a report at the end of last year, looking at how our parents are experiencing their parenting right now and what their general life is like. And it really was sobering for us in that 33% of parents reported high levels of stress in the past month. That's compared to 20% of other adults that weren't parents. 48% of parents say that most days that stress is completely overwhelming. That's compared to 26% of other adults. And 41%, this is just mind-boggling me. 41% say that they are so stressed they cannot function most days. And nearly 50% were feeling completely overwhelmed. So those are the people that are walking in your office. Those are the people that we're encountering on the street or in the care that we're providing. I think we have to make sure we're aware. So a couple caveats. As I said, the lion's share of work being done in families is being done by moms. I think that's really important to recognize and acknowledge that we can talk about dads and their involvement. I think it's really important, but we still have to recognize that moms are carrying most of the burden here. Oops. Number two is interpartner violence. Both 1 in 5 women will experience it, and 1 in 7 men will experience it. That's a really important issue to be thinking about all the time when you're working with families. And I think I just want to bring that out as well. Finally, who's living together? We really don't have good data on that, right? And we don't have very good data on any different types of family constellations that are happening out there. So a lot of good work that can be done in that area, both kind of at the local level and at the national level as well. But I was giving a similar talk not that long ago, and someone said, you know, it's like Scotty and Michael, right? And you guys must remember the Bulls, right? You're not that. So, I love that analogy because it's true. Michael was great, right? He was a GOAT, right? But he couldn't have done it without the rest of the team. So when I think about that analogy and what this one participant in the talk was telling me, he's like, you know, Michael could be the mom, and Scotty and the rest of the team would be like the dad, and the rest of the time come together. So I love that analogy. It works in the Midwest too, and just wanted to share. So why are fathers important for the physical and mental health of the family? So they're key in child health and development. So I want to talk about a couple of those things. From a physical health perspective, fathers are involved, is associated with improved weight gain in preterm infants and higher breastfeeding rates. There's a greater likelihood the child will receive appropriate doctor visits, vaccinations, and adherence to medical advice. And there's a role model for behaviors of how you act, not only in the healthcare system, but in general, how you act toward your partner, how dads might act toward their partner, and in relationship expectations that are set for the child then as well. Other research has shown that if the father has poor health, the children are over three times more likely for overall health themselves as well. From a mental health perspective, if the father has poor mental health, children are 2.6 times more likely to have poor mental health. If the father's involved, there's a reduction in child depression and anxiety and greater expressive language. So if you think about when moms and dads might be walking down the street with a stroller, moms are going to describe one particular scene in the same street, and dads might describe something different. So stereotypically, moms might be like, oh, look at that flower, that bush. And dads might be like, look at that truck over there. And all that language, that those different words and different ways to express it really come out and help support the development of that child. Fathers are key in maternal health, and my guess is that's what a lot of you all work in and think about. So if fathers are involved, there's improved prenatal care with an engaged father. There's improved maternal sleep and recovery during pregnancy, and involved fathers encourage healthier maternal behaviors in general. From a mental health perspective, 10 to 15% of women experience postnatal depression. Co-parenting can reduce maternal stress and depression. Maternal emotional support can be protective against postpartum depression, and maternal overall well-being improves with engaged fathers. It's next, at the very least, it's an extra pair of hands and another support person. So the transition that fatherhood also impacts men's health, and this is a newer concept in kind of fatherhood research, that not only is the dad, we're used to say, oh, you know, dads are good because they help mom, they help baby and bring home paychecks. Well, that's changed now. And people are thinking about what's the impact on dad of being a father, having a child, and how does that impact their health and well-being? Well, it turns out new fathers, when you interview them, will tell us, and these are from dads that are lower socioeconomic status, unmarried. It's a specific study that we did. We asked them what was the impact on their health and their kind of perspective on life after having a child, and they described wanting to be there. They wanted to be there when their child entered kindergarten. They wanted to be there when their child graduated high school. And that was a new idea for them. So they told us that they were trying to avoid being in riskier behaviors and riskier situations than they had been in the past. And they adopt healthier behaviors. They may gain, this is the dad bod. Has anyone heard of the dad bod? Okay, right. So, yeah, there's shirts about the dad bod. It's just great. So we actually, and this is our contribution to it. We actually looked at a bunch of dads versus non-dads and figured out that's about 5 pounds of weight gain for a dad compared to a non-dad. And that's what the media says contributes to the dad bod. There's a lot of things that go into it, but the media loves that idea. They can increase their physical activity, and they're still, though, less likely to be in the healthcare system and less likely to have a primary care provider. What's happening in the dad's brain as they become a dad is really interesting too. These areas that I've highlighted here are the areas that light up when a baby cries. So there's a physiologic response to having a baby and trying to interact with that baby too. These are the areas of the brain that are used for critical thinking, for language processing and emotion. These other areas here in the blue are changes that happen in the dad's brain after becoming a dad compared to before. And these are areas that are important for visual processing and identifying the infant's needs. And then hormonal changes we hear a lot about too, where cortisol, which is increases with increased father involvement, and testosterone actually decreases. And one of my colleagues at Notre Dame actually, it was responsible for that research, looking at the drop in testosterone. The idea is that these new dads are trying to nest instead of going and fight a saber-toothed tiger. Like that's what they think is fine. And then oxytocin and prolactin also may change in relation to maternal nurturing as well. So now let's just look at the mental health of dads. 10% of fathers will experience postpartum depression. And postpartum anxiety, like what we see in moms, is probably even more common. We just don't measure it as well. 3% of paired fathers and mothers experience postpartum depression at the same time. And paternal postpartum depression is associated with, from a parenting perspective, increased negative parenting and decreased positive parenting behavior. So depressed dads are less likely to be reading with their child, engaged in positive activities, and they're more likely to actually be using corporal or kind of physical punishment for their child. Can we take it? Do I have a question?
Yes, is there a sign that is showing that, hey, dad doing it?
The dads are?
Yes.
Are depressed?
That's the one you just mentioned.
Yeah. So I'll talk about some of the risk factors, but I think one of the things that we don't do very well is, first of all, think about it. And second of all, try and screen in the way that we might with moms for those dads that are. So I will definitely talk about that in 1 second. From a child mental health perspective, the children of fathers who have postpartum depression have higher rates of mental health problems and twice the rate of emotional behavior problems. So it makes a lot of sense that we think about this when we think about the families that over. So some of the precursors and risk factors, fathers report that what impacts their mental health is the stress of role balancing. So becoming a father, a husband or a partner, and an employee, right? Because in this country, we really don't have any sort of quality paid leave for dads. The inadequacy in childcare. So childcare issues are really important when we think about how we support families early on. And I think it's one of the things that, as Lisa mentioned, I was in Australia, they do a really good job with childcare there. That could support families. They're worried about the pregnancy, the delivery, and the child's future. There's irritability due to sleep deprivation and guilt around returning to work when the partner is still at home. These are real feelings that dads are having. And then factors that are associated with the increased risk of depression are unemployment, negative life events, stress, financial strain, history of mental illness, mom's mental health, low marital satisfaction, and low social support. So this hopefully gets to your question. There are a number of different survey tools you can use, screening tools that you can use that have been validated with men. These are a list of them. The one that's used most frequently is the Edinburgh Postpartum Depression Scale. How many people here have heard of that one or used that one? Yeah, so that one is a valid one to be using with dads. It's pretty well studied. None of them are perfect, right? No screening tools are perfect, but it's somewhere to start. And I think that's one of the biggest piece of advice I'd like to share with you is just start with something and then you can make a change down the road. But the cutoff scores are a little bit different, a little bit lower for dads. And all a screening tool is, if you remember, is just raising the fact that something might be going on with this person. And so worth further discussion. So I want to talk a little bit about, how am I doing on time? I want to talk a little bit about, oh, great. Okay, so I can slow my roll a little bit. So I work primarily now in a neonatal intensive care unit, and I love it because it's like the best petri dish of what's going on in families. Super high stress, totally unexpected that you're going to end up in the neonatal intensive care unit with a sick baby. Either that baby's born early, premature, or the baby is having difficulty transitioning from being inside of mom to being outside. So I like to think of it as like a microcosm of what's happening in families and how we could do what we should do, where are we thinking about when we're working with these families. So I want to talk about one study that we did where we looked at, we actually used the Edinburgh Depression Score when families were admitted into the NICU. And then we followed them out after they were getting discharged, and then they went home as well. So this was a prospective study of families that got admitted to the NICU, 431 parents. We had 201 fathers and 230 mothers. And we gave the Edinburgh at these different time points. And so what you can see on this graph here is the Edinburgh score is going up and down, and then time on the bottom here. So the first point is when they were admitted. The next one is that discharge. The next one is 2 weeks after discharge, and then 30 days after discharge. The triangle is dads, and the circle is moms. It doesn't matter which one of those sets of lines you looked at, dashed or solid. They're kind of telling the same story. But what you see is that moms come in, maybe look at the dash one. Mom comes in with a little bit of a higher score. And by the end, the circle is she's actually back down to more normal. Dads really come in and leave and are at 30 days after discharge about at the same level, right? So my kind of take home from that is that there's really no change in dads. And why might that be? Because we really don't deal with that. Right? They're just kind of chugging along. Whatever they were coming in at, they're still at. Moms, on the other hand, we really try and bring out some supports in the NICU for her. And then she actually improves over time. Sure, some of it could be physiologic, right? She's getting past the postpartum blues and kind of doing better. But in general, that's a pretty significant decrease in depression scores for her. And the other thing we did with this study was like, okay, well, if you only have the resources to do one screen during that NICU stay, and some NICU stays are 3 to 4 months, which one is the most valuable? And what we found out is it almost doesn't matter. Just screen once somewhere along the line, and you can start to pick up who's at most at risk in these situations. So then we did another study that had really never been done before. I told you about cortisol changes in dads. And over the course of becoming a parent, we wanted to look at cortisol changes in the NICU for moms and for dads. So cortisol is a stress hormone. It's what again, evolutionarily, when the saber-toothed tiger comes, your cortisol level is going to go up because you're really stressed, because you need to run, fight or flight. That's what kind of comes with cortisol. And so we looked at a cohort study of parents in our NICU. It was 86 mothers and fathers of very low birth weight babies. So these are kind of the sickest, smallest babies. And we looked at their saliva cortisol 3 times a day during the transition home. So God bless these parents. They were willing to spit into a tube, and we took that spit 3 different times, 5 mLs, which is like a teaspoon. And you think that's not very hard to do. It is really hard to do if you've ever participated in this sort of studies. It's a lot of saliva. And we take that saliva, measure the cortisol level in the saliva. And so again, people had done this with mothers. They'd done it in the NICU, right? A stressful situation, and their cortisol levels were high. But no one had ever done this in dads before. So we were like, let's compare dads and moms and dads. So if you look on this graph here, we did it at the day before going home, the day after going home was the second point, 5 days after and 14 days after, right? And so the solid line is mom and the dashed line is dads. So they start out the same, right? They're both stressed. These are stressful levels of cortisol in the NICU at that first point. And then they start to go home, and moms are kind of like, they come out about the same, a little bit, maybe less after they've gone home. But dads, they're just reaching higher and higher and higher, right? So their cortisol levels and their stress levels are much higher once they've gone home than they were even in the stressful NICU. And no one had ever looked at this before. The other thing that we did was we asked them survey questions, right? Like, how stressed are you? And moms correlated. If they were stressed by cortisol, by physiology, by their hormones, they reported being stressed on the survey as well. Dads, who we know are very stressed, were not scoring themselves or answering the questions to say that they're stressed. So either the survey isn't working, that could be one critique, or dads may not be in touch with the stress that they're experiencing, and certainly aren't aware of what's going to happen when they go home and they're more stressed out. So I do a NICU dads group, and we talk about this, like, hey, things are great, they're very excited to go home, but then they go home and these dads are more stressed out. And why is that? Well, if you think about it, in the NICU, you have expert professionals who are taking care of your baby. You get to kind of a status quo, you show up, you do your care with the baby, and then you go home. Then you go home, And now these dads have to, and they told us this, they want to help take care of the baby, right? We've talked about that. They know how stressed and the mom is, she's still recovering and she's breastfeeding every 3 hours, right? And then they also are trying to be back at work and they're trying to take care of themselves too. So that we think is kind of hypothesized why there's this increase in stress. So to kind of summarize all this, fathers can influence the physical and mental health of the offspring of their offspring and their partners. I hope that's clear. There's a bi-directional effect wherein fathers impact child well-being and the children can impact the father's well-being. And as I said, that's a newer concept in the area. And the physical health and mental health of fathers is impacted by becoming a father. So that transition to fatherhood is a great lever for change. We need to be taking better advantage of it. But despite the growing evidence, however, the needs of fathers, especially in stressful parenting situations, are often neglected. So I really, hats off to you all for saying we need to be doing something about this and thinking about and learning from this. So I want to shift now to what's happening on a more national level. And this is, like every day is different at the national level, we're finding out. But I want to talk about a project that we started some time ago called PRAMS for Dad. And it really is the first paternal perinatal public health monitoring. So how many people here have heard about PRAMS? Oh, awesome. Okay. So PRAMS is the Pregnancy Risk Assessment Monitoring System run by the CDC from 1987 until January. And it is a randomized birth certificate sample. So every birth, staying in the state of Indiana, is randomized to be survey of the mom. And it gives really good information on maternal experiences in the perinatal period. It's done by a mail and a phone at 2 to 6 months postpartum. And at the end of the day, it represented 81% of US births. So fabulous data source, the only one of its kind. Actually, one of the, all of the other countries are jealous, having just been around talking on these different things. They love our PRAMS data set. And it gives us information on when moms started prenatal care, were they exposed to substance abuses, are they breastfeeding, what safe sleep behavior they have, the mental health amount, awesome stuff. And this map represents kind of all the different states that are there. And so what happened after 35 years though, is that moms would scribble in the margins of the survey, why do you only ask if my partner hit, kicked me, or slapped me during my pregnancy? And they went on to write to say, the only way I made it through this pregnancy was with the help and support of my partner. So the CDC approached us to say, how would you include dads in a survey like this? And we spent a lot of time thinking about that. First, we had to understand why we want to include fathers. Well, we know, as I talked about, fathers play a key role in the health and development of their children, and fathers' health status and behaviors influence pregnancy behaviors, mom's health, and infant and early childhood development. But we really didn't know much about the roles and behaviors of expectant fathers. And fathers' influence on maternal child health was something that we need to explore more, and the effect of that transition on fathers' health, as I just talked about. But the opportunity is so huge because if you can impact dad, you end up having a 3-time benefit, right? You can help mom, you can help dad, and you can help baby. I think that's why I'm here. So we developed PRAMS for Dads, or we call it the Fatherhood Survey. It's a validated survey of men's health, their attitudes and experience in the perinatal period. Offers comprehensive information about the father, links mom's responses and dad's responses, and information from the baby on the birth certificate. So it's a wonderful way to actually think about triangulating what's happening in new families. We had to figure through what happens in unmarried couples because our birth certificate collection information is kind of, if you're married, it's one type of information. You have to do an acknowledgement of paternity or acknowledgement of parenting. It depends on which state you're in. But about 85% of those are collected. So 15% of births to unmarried couples, we don't have any information on the partner. And that may be by design, different couples deal with it differently. And we wanted to do this online, by mail, and by phone. We wanted to mirror the maternal PRAMS question so that we could actually corroborate some of that. And we wanted to really be thinking about all types of families, right? I think this artificial split of maternal child health where we have moms and babies and then everybody else doesn't really work anymore. And we're trying to kind of compensate for that. So we piloted this in Georgia. And these are the domains of the survey questions that we kind of thought were going to be important. Things around like their relationship status. Did they use family leave? That's a big discussion in this country now. What type of health insurance does the dad have? What type of access does dad have to healthcare? Recognizing that men are the least likely to be in the healthcare system from 18 to probably 50. Was the pregnancy intended? How involved is the father? What are the safe sleep behaviors and the breastfeeding support, the co-parenting ideas that the dad has, adverse childhood events, discrimination, and breastfeeding. So all the key public health issues that you would want to discuss. And then this is just an example of when I kind of talk about this sort of work, you kind of have to go back to the very beginning. And this is on the top, the yellow envelope is the one that was sent to moms. So we have to think, okay, what's it going to be like for dads? They have to recognize that it's not the same as mom, that we uniquely want dads. We call out dads. So on this blue belt of the survey, this is the survey cover, it says Georgia Prams for dads. And our envelope looks different too. So when you do this kind of work, it's not just like, oh, sub in, copy paste mom for dad. That's not what it is at all. You really have to go back and think about what is the experience of that dad and how do you tap into that? So I just want to share briefly some of the results from that. This is again in Georgia. So about less than half of the dads actually had a primary care physician, right? So anything that we're thinking about, well, dad should go get help. Dad has this health problem or even this mental health problem. Half these dads don't even have that, and they haven't, and even fewer have seen a doctor in the last year. Most are using contraception. 65% of the pregnancy was intended. All of the dads surveyed wanted to be involved in raising their child. Most were employed living with the baby, and only about 3/4 actually had taken any sort of leave after the birth of the baby. So I'll show you some data on that in a second. When you think about the health behaviors, though, and again, if you're thinking about the overall well-being of dads, about 70% of the sample in Georgia was overweight or obese. 20% were currently smoking, 13% were binge drinking, and 5% were using marijuana. So this is actually pre-COVID data, so I think that some of these may have changed. But 10% were endorsing depressive symptoms on our survey. We, again, as a pediatrician, I think a lot about the impact on the baby. So we did a study that looked at fathers breastfeeding and infant sleep behaviors. And what we found is that this is again from the sample in Georgia, and the blue is if the dad wanted the mom to breastfeed, and the can I say maize in this room? The maize color here is I didn't want mom to breastfeed, or I had no opinion. And what you can see is that much more higher bar, more likelihood of ever breastfeeding or breastfeeding in 8 weeks, which is a great outcome for us in pediatrics, if the dad wants mom to breastfeed. So I think that's one of the reasons why it's important to be thinking about dads when we think about how do we get our breastfeeding rates higher. When you look at sleep practices, another thing that's really important from a pediatric perspective, 99% of fathers reported putting their baby to sleep. That makes sense, right? They're there, they want to be involved. It's a lovely time to be with your child. But when you look at these 3 safe sleep behaviors, which are putting your baby on the back to sleep, on an approved sleep surface, and no soft bedding, this is what reduces the risk of sudden infant death syndrome or babies dying suddenly in sleep. Only 16% of dads practice all 3 behaviors. So again, if we want to look at opportunities to improve the health and well-being of children, we need to be including dads. And I know that what's happening in many hospitals across the country, while we're giving instructions to mom in the nursery about how to take care of this baby and how to breastfeed, obviously, dad often is outside in the parking lot, right? We haven't welcomed him in, we haven't included him in the conversations. And so that's a huge opportunity for us. And now it doesn't take any extra work besides just acknowledging and saying, hey, dad, do you have any questions? Let me tell you why breastfeeding is important. Here's some things that you can do for that. So our research gets a lot of attention, and I think that's it is one of the reasons why I do it. That breastfeeding study was featured on Good Morning America. In June 2024, I was invited to present to the Congressional Dads Caucus in DC, the work that we're doing in PREM. So there is a momentum going forward, and I'm very kind of excited about that. And we'll see kind of what the future holds for all this sort of stuff. Because one of the big topics that is now being discussed and having, again, traveled around internationally, that paid leave, that parental leave early on is super important. because everything gets set up in those early days. And while many dads were like, what am I supposed to do? Like, she's breastfeeding, you know, I'm gonna go to work and I'm gonna bring the paycheck. But actually there's a lot of learning that's going on with that dad at that time. And those times are really important. So we looked at the fathers in Georgia who had either paid and unpaid leave, and looked at kind of what the impact was, again, on something that we care a lot about, which is breastfeeding. So first we looked at how many of them had paid leave, and if you had paid leave, what did that do for the length of time that you had? Because other research had shown that if you take more than 2 weeks of leave after the birth of a baby, that dad is much more likely to be involved in when the baby's 9 and 12 months old in the activities of daily living. So more likely to be reading to the baby, changing the baby, feeding the baby. Why? Because they built their confidence early on. So that's really the importance of paid leave. So if you get paid leave, you're much more likely to take more than 2 weeks of leave, right? And so then let's look at what happens with taking family leave, paternity leave, and breastfeeding duration. So again, on overall and among just those who had actually started breastfeeding, the dark blue is if you took more than 2 weeks of leave, much more likely to have started breastfeeding for the mom, and much more likely to be breastfeeding after 2 months down the road too. So these things are related. The policies that we support of our families have an impact on what happens at the family level as well. So where we're going with prams for dads is my hope is 30 by 30. So I'm hoping for 30 states by 2030. These are the 8 states that we are in right now. So we went from Georgia to these 8 different states. And what I love about this slide is that the personality of each state comes out, right? So I didn't know that in Maine, for example, everybody knows those boots are Maine. And I was like, well, that's kind of interesting. You can see Georgia up in the top, on the top corner. Massachusetts is cool because they have on their birth certificate a box that gets checked off on the non-birth parent, it's called. So we know when we're sending out a survey, if it's a father, and we send out a male-focused survey, and we know if it's not a father, and we send out a more gender-neutral survey to those families in Massachusetts. Michigan is doing this both in Detroit and in Kent County. North Dakota is doing it, Ohio, Maine, as I mentioned, and then Wisconsin is on board too. We actually have New Jersey as well that started. Yeah, so these are the different states and the different places that we are involved. We have over 8,000 surveys now of dads. It's the largest collection of information on fathers in the prenatal period ever. And we're just starting now to weight that statistically so that it represents the population within the state. And then with all the shakeup in at the federal level and more pressure being on the states, we asked the states that are part of the PRAMS group that are trying to resurrect PRAMS after the changes that happened in January, how many of them wanted to be including fathers. So the dark blue are where we already are, and the light blue are the ones that are interested. And if you look very closely, not even very closely, you'll see Indiana there too. So Indiana is very interested. It's a matter of how do you keep both things going at the same time. So basically what I want to share with this is we don't know what we don't measure. We can't change what we don't know. So that's the purpose of trying to think about this at a larger level. The fathers are available, willing, and interested in being contacted. And really for the first time, we have a reliable source of surveying that we can give out to people, and that can then be used for making change in policy. So real quick, the last thing I want to talk about is ways to engage fathers. And my challenge to you all is like one or two ways of something that you've heard today that you can text back to the office like, we should be doing X. Right? We've been thinking about this. You're here because you're thinking about it. What is the X? What do you want to do that's going to be inclusive of fathers? So really a foot in the door for engaging fathers is at the very base, like using pamphlets and handouts and material that include fathers. That's not enough though. You have to really think about it. I work in a women's hospital, and that women's hospital, men have told me, for example, one of the things that we talk about a lot is should we be trying to get men in the OB office? And one of the dads that I work with said, the OB office is like walking into the women's bathroom. I know I don't want, right? So we have to think about what that means. Using eye contact and being inclusive at all points of contact from the front door all the way back. In this case is thinking about healthcare of interacting with clinicians as well. Thinking about when do we need, for example, screening for partner violence. very important, and the dad is not gonna be in that room. But how do you then make sure it gets back in? How do you explain what's happening in a kind of a more sensitive way, including screening, as we talked about, for mental health, and going beyond the small talk. It's nice to get started with, how did Notre Dame play or whatever, but then getting into substantive questions, and dads want that interaction too. From a public health perspective, I hope, like I said, early and often, get those dads in, get their hands on their babies, get them engaged from the very beginning, and that makes a difference down the road. If there's one thing we can start to do now, particularly in this group, I think it's screening for maternal postpartum depression, and we'll be working on the updated American Academy of Pediatric guidelines around screening and when that should be done. It looks like it's around the fourth month of birth, and then training up the workforce so that people feel comfortable. And in this group in particular, I've just mentioned Movember, which is the guys that like grow a mustache in every November, and then you pay them to shave it off. And they raise money for Men's Health, is doing a lot of work around fathers, and they have this wonderful Men in Mind program that helps basically therapists think about engaging with dads. How do you talk to them? And they follow 4 people through that. It's a wonderful thing. I did. It's really great. And then I really can't say enough how important it is to have public health information and actually make decisions off of, instead of just anecdotal one story and another story. So finally, to conclude, the role of fathers is changing. I hope that's clear now. That has real benefits for children. And that transition to fatherhood is a key lever for change in dads and men as well. And that can improve the outcomes for children and families and fathers. So I want to end with this one last, has anyone seen this video? It's great. So just ways that dads reimagine what's happening with their children, and it just something to kind of think about when they're not in your office, what they might be doing. So I'll end with this video.
I see you love it, know about her. Let's go. Let's go. Let's crawl. Let's crawl. Let's crawl. Yes, and don't be mopping. Come on, girl. Let's crawl.
Guys, thanks for participating. That goes to our group in Chicago, and the other one goes to signing up for a newsletter. So we'd love to we put out a newsletter every time we kind of produce something that we think is of value. You won't get a ton of emails, but it's a way to keep eyes on the work that we do. So thank you all very much.
Just one or two questions.
Sure. Okay. Yeah. Thank you for your patience. Yeah.
Oh, thank you. I have 2 questions.
Yeah.
I'm looking at your information from Georgia. 40% of dads had a primary care physician, 30% had healthcare visit of any kind. Did you have information of insurance? Did those fathers all have access to insurance? Is this an insurance barrier issue? Is this an access to care issue?
I think it's both. The question was, of the dads that didn't have access to a doctor, was it an insurance issue? Or was it just that they didn't go? I think it's a combination of those things that, so one of the biggest groups that improved their healthcare of having insurance after the ACA was men, right? But whether they don't have access to it, we haven't dug down into like these rural families where they may not have much access to the doctor. But either way, they're not going to the doctor. I think that's kind of one of the take-home messages of it. And part of it is, if they don't have insurance, they're not able to go see the doctor. If they don't know where to go to see a doctor, that's another piece too. So all that is to say that once a baby is born, many men are trying to think, oh, this is real. I got to figure out, I got to get myself together. And that's an advantage that we have to say, one of the things you can be doing is getting your health checked out. You may be walking around with high blood pressure. You may be walking around with diabetes. Like, these are things that if you catch it earlier, it has a better outcome down the road for that dad.
My second part of my question is tied into that. For us that work in healthcare industry, do you have any
Nice.
Do you have any information for us? Of course, we know that everything is based around budgets. Is there information that is out there of how supporting dads financially would improve the overall health of the community and for the healthcare system?
That is a great question. There's work actually being done in Kent County, mostly with, so that's a great question. If you think about it, most of the work that's been done on that, it's giving moms money.
Yes.
And that is cutting edge now, right? I get lots of discussion around universal basic income and ways to support babies and things like that from birth with deposits into their accounts and things like that. All that has been really focused on moms. I haven't seen anything that focuses on or thinks about that. So that's a really innovative idea. And I think hopefully sparks, different ways to do our policies to support families move on. Yeah. Sorry, I don't have a better answer, but you're onto something. I'll say that. Yeah.
Dr. Garfield, thank you so much.
I am the Director of the Community Access, Resource, and Education Unit at the St. Joe County Department of Health, and I oversee the maternal infant health initiatives. We are so thankful to partner with Lisa and MHAM as dad's involvement is also a focus of our initiatives. So I'm going to introduce the first panel, which is local prenatal program discussion, discussing strategies to engage dads and partners. We ask that you hold any of your questions to the end because we are going to do a Q&A section after. First, we have Michelle Pellot. She is the Family Support Supervisor at Healthy Families of St. Joe County. We also have Kiana Jackson, who is the Supervisor of the Family Success and Self-Sufficiency Program at the Youth Service Bureau. We have Chaquisha Jordan, who is the Maternal Infant Health Coordinator at the St. Joseph County Department of Health. So we're going to have Michelle come and speak about her program and what she does and how they engage dads.
Good morning, everyone. First, I'd like to thank everyone for being here today. Just you being here is a step forward in being able to impact our fathers in our community and showing up for our fathers. So my name is Michelle. I'm a family support specialist supervisor at Healthy Families of St. Joe County. I work for Family and Children's Center, which has two programs, Healthy Families and Brain Train. So Healthy Families is a home visitation program. We work with prenatal families from prenatal all the way to their children turn 5 years old. We are a free and voluntary program. We do everything from working on family goals, child development, screenings, mental health screenings as well. We also have our Brain Train program, which is a program that is a positive play group for families. We do individual play and group play, socialization through play and learning through play, and increasing positive parent-child interactions. The way that we engage fathers is from the beginning to the end, from intake all the way through the entire program. We invite fathers to be a part of every step. We invite them to be a part of every visit. We include them on the child development pieces, the parent-child interaction, also working on their personal goals. We work with the family as a whole. We don't like to exclude anyone. So we also engage fathers if they are single fathers. We enroll single fathers. We enroll fathers if mom is not available for the visits, but dad is. We will enroll dad in those programs as well. So both of our programs engage fathers 100% of the way. We provide them the same resources and access to community events and resources that we would any mom in our program. So that's how we engage fathers in our community. And once again, that's Brain Train and Healthy Families.
Good morning. My name is Kiana Jackson. I'm with Youth Service Bureau. I'm the Family Success and Self-Sufficiency Supervisor for that program. Youth Service Bureau has been in the community for about 55 years, or maybe 53, somewhere around that time. It's a little bit older than me. And we have a program that is a home-based case management program. We go out into the homes and we work with the entire family. A couple years ago, our name was the Young Mom Self-Sufficiency Program. So we were not doing a good job at targeting dads. We were kind of isolating them just by our name. So what we did is last year, we went back to the table like, you know what, we're servicing dads, but we're not really having a name that is inviting to dads. So we changed our name to the Family Success and Self-Sufficiency Program. A lot of our pictures and our flyers are being changed so that we can welcome fathers into the space. We have worked with dads on a one-on-one basis since the beginning of time that I've been there. So I've been there 11 years. And some of my best clients have been fathers, single fathers in particular. When they come to the program, we figure out right away that they're shy, they're nervous. Sometimes they don't have that trust because they haven't been welcomed. They haven't been welcomed at the doctor's office. Sometimes they haven't even been welcomed by the mother because we work with a population where sometimes the parents are not on the same page. And so making them feel welcome and invited and wanted is very important when delivering services to our fathers. Once we get the fathers enrolled in our program, all of our services are free. They're very low barrier. There's no financial requirements or any kind of financial limitation. So you can come from a low income or you can come from a high income and we'll still be able to service you. Because sometimes there's a misconception that people that are not low income don't need these services. However, they do. We do a one of the big pushes that I do with my team is to make sure that we are being very much an advocate for the father, a cheerleader, and a participant, helping them to get to the goals that they have set for themselves, which is that self-sufficiency piece. So we ask them to advocate for themselves also, making sure that they take the time to go to doctor's appointments, and to just really just make sure they're asking the questions for things that they don't know. We have not done the best job, I would say, as an agency and doing some of those screenings. I was very much excited by the presentation earlier today. So those are some of the things that I think we can take back, me and my team, when we're working with a new dad, doing some of the screenings that we would do with them. So, because we have not always done that. So we've done some of the other screenings, but not quite the ones for the, right after the tax one. So thank you for sharing that with us. One of the things that we have found is that when you're working with a dad, if you give them the chance to talk, they will talk, and they will give you so much information. The willingness and the desire to do things for their child and to make a difference is very much important to them. And so all they need is that opportunity and that space to thrive. So being able to be there and to let them know what things in the community are available for them, because they've come in and are so frustrated because they don't think that there's anything available for dads, especially when it comes to like custody or getting birth certificates or getting the things that they need so that they can take care of their child. They don't feel supported. And then if we have a father who is a stay-at-home dad, they really don't feel respected, because in this country, we don't always look at the stay-at-home parents as a vital part of society, which you are the ones that are developing the next generation. And so it's crucial in those early stages to be given that information to the babies and to spend that time taking care of them. So the way that we deliver our services is we come to the client wherever they are. So if they are housed or if they're unhoused, we'll go to them, pick them up, bring them to our space or meet them where they are or wherever in the community that would be a safe space for them. And then we give them usually 2 hours of uninterrupted time each week that we are working on the things that they need for their family to keep them supported. We do have some things that are tangible that we can give to families, like diapers, wipes, hygiene items. And when we started seeing more dads, we noticed like we have women care program products, but not many men's products, right? So we started adding some of those things to our personal pantry so that we could have things to offer to dads. When we have group settings, so that's groups so that the parents can kind of interact and meet other people so they can build their social supports. And so when we start having those groups, we want to make sure that when we have dads, they're not only the minority, but making sure that they feel welcome in those spaces. Advertising wise, anybody in the community that is here can refer someone to our program. They usually just give us a call and then we'll make the next steps in reaching out to them. A very low barrier. We are very accepting and willing and wanting to work with fathers. Thank you.
Good morning. I am Chaquisha Jordan. I typically go by Quisha. I'm a registered nurse and I'm the maternal infant health coordinator at St. Joe County Health Department. The main two programs that we have are Ember, which is our series of perinatal health education classes. And then we also have a pregnancy and postpartum support program separately, where we check in on families through each month of the pregnancy and all the way through 18 months postpartum. So our Ember program, I'll speak on that one first. We designed it so that the color scheme is a little more inclusive. So the amber, fire, orange. So with the colors burgundy and burnt orange, we wanted to move away from the typical pink, yellow, girly kind of stuff to let the family know as a whole that everyone is invited into this space. So we cover a lot of pregnancy and postpartum related topics, such as complications, warning signs, safe sleep, car seat safety, kind of the whole gauntlet. And while the primary audience are the women who actually are pregnant, we invite them to bring all of their support people as well. So partners, siblings, aunts, uncles, best friends, whoever. And we did find that a lot of them have started to bring the dads to the classes. One of the things that kind of gets the guys a little bit into it, sometimes during the late pregnancy discussions, we'll have the dads wear the pregnancy belly so that they can kind of get an idea of what it feels like, what mom's body is going through as well. But just when we ask them questions, specifically, dads, can you answer this? How does this make you feel? When we asked them directly, they were more willing to speak. And I think a lot of the dads typically, when they go to the OB visits and everything, the focus is on mom and they're just sitting there for support. And so, yes, we found that, Dad, how do you feel about this? It gives them that avenue to open up and say whatever it is they've been holding in. They provide a lot of valuable insight with that. Even like how they can support in breastfeeding, or as you mentioned with the safe sleep, that a lot of time dad is putting the baby to sleep. And so making sure that we're educating, we're supporting the whole family inside of that. And then also because a lot of times dad can be the best advocate for mom. So whether that's in the OB visits, maybe something she forgot to mention to the doctor, or in the labor and delivery space, hey, my wife, my partner is having this going on and she feels like she's being heard. I don't know if anyone's familiar with the For Care and for Moms project. So, yes, Kelly. So dad lost he lost his wife due to postpartum complications. And so he's made this national project that's been going on for some years now. And so he has spoken before Congress and things like that about what happened, what was his wife's experience in that space and things that were missed. And so we educate the dads that a lot of times you can be mom's best advocate. You might notice signs that she doesn't see. And so do you know what the warning signs are? Do you know how to best support mom? So if something seems off, you're able to bring that to her attention and also bring that to the provider's attention as well. Outside of the classes, the pregnancy and postpartum support that we offer, you mentioned about sometimes the dads aren't insured. So our community health workers are licensed Indiana insurance navigators. So when they do that initial application for mom for presumptive eligibility for pregnancy, they can do the insurance applications for the whole family. So if there's other kids, partners, anyone else, we try to get all of them taken care of up front. And we know that any issues that impact the dad in the household, they're also impacting the whole family. So are there any issues that your family is struggling with? And so trying to connect them to those resources as well. And we've even had a few in the program that are not the biological parent of the baby, but they are in support of that baby. And so they're still offered these same services. So I think that was it for now. I will let you know.
Okay, now we're gonna have some questions for the panel. I'm not sure if you want to step up to the mic so everyone can hear you, or if anyone is gonna take the mic around. But if you have a question for anyone on the panel, I'm gonna start first by saying, if you want to highlight or talk about any successes or challenges you have had in your program trying to engage dads, maybe something that really worked or absolutely did not.
I think for us, one of the successes we've had is we've had an increase in father enrollment and father engagement over the past couple of years. So that's one of our successes. One of the negatives is we really don't have a lot of resources in the community to refer them out to. So it's important when we are able to collaborate with other agencies and just have spaces like these where we can see what is out there, and also as agencies be able to gauge how we can better support the fathers in our community. So I think that's been our major barrier, is not having somewhere for fathers to go to take additional classes or get support or mentorship. That's been one of our barriers so far. So we're getting them in, we just don't have anywhere to send them when they need something beyond what we can do.
I would say for us, if we are able to get someone in the door past the initial phone call, we are very successful with getting them to stay engaged in services for the full 4 to 6 months. I wish that we had more dads enrolled at the same time so that we could offer exclusive groups that would be triggered or geared just to the dads.
So some of the successes that we have had are the dads are starting to attend the classes more. But definitely some of the challenges, definitely getting more, even more of them in. A lot of times, things like this are figured, oh, that's for moms. And so just getting it to be a bigger push to get the dads to come in as well.
Any questions from the audience?
Oh, wow. What kinds of things are dads asking to be referred out to?
So I would say some of the biggest things that we see at YSB is legal resources. So when dad's taking care of a child and he may be the primary caregiver, however, he is not, he doesn't think that he has full custody or, majority custody. So that's one of the things that we have a lot of need for. Also, sometimes we get fathers who come in with a background that may not be legally, so they're looking for resources for employment, where they can make a livable wage and take care of their family. And then child care resources as well when they don't have primary custody of the child legally.
I would say for us, it's been all the same things. Housing is one. If we have a single father that has custody of their children, housing has been a big barrier. Being able to go to, it seems like they don't have the opportunity to start over. Like if I were to have to start over, I can find a plethora of different places to go, as a single mom to start over, where dads don't really have that. In the community, I feel like that is one of the things that we get a lot of. Mentorship. They want to see other fathers that not only look like them, but have the same lived experiences so that they can have people to talk to, because we can go into the homes and, bring them in and they're part of the visit, but sometimes they need something outside of, being in that space with the mom and the other family members. So I think that's mental health definitely is one of them, especially uninsured mental health services.
Has there been any, I would say, needs assessment, father-specific needs assessments done in this community?
In the community as a whole, I know in our agency in particular, we do a needs assessment at the first visit for anyone that's involved in the visit. So we do one with mom, we do one with dad, because we know their needs could be different. And then we use that to plan our visits and also to research any community resources that we can get for them. Once again, there's more for moms and babies than there is for dads. So that's why things like this are important, so we can kind of see what we need, what is lacking out there.
But as far as the community-wide needs assessment, I don't think that there has been one that's been focused on that. I know that Rural Services puts out one every few years as part of their strategic plan, which addresses the whole community, but not something that's specific to dads that I'm aware
And for ours, I would say, under maternal infant health, we have community health workers that specifically work with pregnant and postpartum moms for, the 18 months. But we also have a general community health worker section that is also under our health department. So if there's like some ongoing needs and things like that, that dad, grandma, whoever else needs, then we have a general community health worker that does work with them, and it is full needs assessment.
For the dads who are coming into your agencies, what kind of incentives or things you're doing to help keep them engaged and keep them committed to coming? Because I've noticed if a lot of men are court ordered, those men have been kind of finishing classes, but the ones that are not court ordered, like keeping them engaged and making sure that they are, committed to doing whatever it is that they're doing with their programming. What are some things you guys have done to help increase that?
So for us at Youth Service Bureau, what we do is, so we do bake coupons. So if they have, children in that age bracket, we do offer them bake coupons. We can offer bus passes. We do transportation while doing visits. So if they have to go to court or if they need to go to the doctor's appointment or any of those types of things, if they want to go to the grocery store and work on food stretch or whatever the case may be. So we provide transportation for it. But I think the biggest piece is that relationship. So once you get them and they buy into the relationship with you, then they are looking forward for your meeting next week. So that's been the biggest thing because we don't have a lot of, we're a small agency, so we don't have a lot of tangible goods to give away. But having that relationship can buy you a lot of time, but sometimes it's harder to get that relationship going.
I agree. That's the same for us. Relationship building is a huge part of it. Making them feel safe and building that trust. So we go into the homes as well so that we're in their space or we meet them wherever they're comfortable. We do babe coupons as well. Babe is an amazing program for our families. And any incentive we give to the mom, we give to the dad. So if we have it, right now we have a safety grant where we do safety items for the family, child proofing kids, baby gates, things like that, pack and place. So yeah, we do, whatever we do for any member of the family, we do for the dad specifically as well. And anything they ask for, like if they need, help with job search, we try to, connect them to those resources. So I think that's a big part for all of us is the community resources and being able to connect them to those community resources.
And then I also wanted to point out too, like you said, court mandated classes. So all of our classes are voluntary. So nobody is mandated to come to see us. Sometimes they have been suggested to see us from DCS, but not mandated. So that also does make a difference. You have people that are actually motivated to want to be in the program. So I think that also will help with the retention of our business.
So if a gentleman were to want to volunteer or get involved or somehow step in and work with any of your organizations, how would they begin? Who could they talk to? What would that look like?
So we get a lot of our referrals from WIC. But one thing that we've been very intentional about this year is actually going out into the community. That's how we know a lot of you here because we go to everything. All the baby showers, all the events, we're there. Because I think that's important. The face-to-face is important because if I see you walking past my table, I'm gonna grab you, mom, dad, whoever. We're gonna talk and I'm gonna tell you what our program is about and how we can help your family. So a lot of our resources come from the hospitals, the WIC, BABE, a lot of other community. There's a lot of self-referrals. So I heard a friend is in your program and they like it. So we get a lot of referrals that way. But definitely going out into the community, the face-to-faces have been extremely important and successful in engaging dads and moms the same.
And then just piggyback off Michelle, same thing. So we're at all the community events. The days with office, they will refer people to us. Jim and us will refer people. Iris, we used to be scanned, would get a lot of referrals from them, word of mouth. All of like the delivery centers. So if they will go into the Eagle Warner was a big referral source for us. And word of mouth is huge because we get a lot of clients who come back and also refer a friend. But if you know someone who needs services, they can call us at 574-235-9231. And I do have a few flyers.
Okay, if anyone wanted to get in contact with us, they would call the health department in general, or my business card is out on the tables. And so outside of the self-referral, we also get some from the health centers. So like St. Joe Family Medicine, Eagle Warner, they may say, hey, I have a pregnant mom. And then when we do the intake with her, she, mentioned, oh, okay, well, this is also going on. My partner needs this and all of that. And so we try to find all of that out at once and get them connected to whoever it is that they do need to be contacted with. But outside of those two places, a lot of the women come into our programs from women's care centers. That's where a lot of them find out that they're pregnant. And so in talking to them, we also try to gauge like who's the partner involved and things like that. And of course, if they are, we're welcoming all of them to come in as well.
And if I could add, I think one thing that I think all of us do a good job at is if I have a family coming in that are teenagers and I feel they have better resources at YSB, I'm gonna send, we do as an agency, what is best for the family. We try to keep the numbers out of it, and if they're best at YSB, I'm gonna send them to YSB. If they're best at another agency, I'm gonna send them there. If they're in higher crisis and higher need, and they're best for us, I believe we'll all do what's best for the family and send them to where they need to be or what is best for them.
And coordinating here too. So like if they have a program that they're running over there, but they could also use our services, then we would work together to service the path.
Any other questions? I have another follow-up question from Michelle, and Kiana. You said that there was increased enrollment in your program. Was there any change in marketing? Do you market your program so that the community dads are aware that they are also welcome? That's one thing from Dr. Garfield that I already jot down for our program. It's like, we need to be including that dads are welcome too, because we don't specifically say that. But did you change anything in your marketing, or was it more word of mouth? Or what do you think the increase with dad participation was attributed to?
So for youth service bureaus, that name change. And so now really going out in the community and pushing the fact that we're not just a young moms program, we are the family success program. And so then also working on some of the marketing, getting some more posters that just highlight the dads.
I think for us, it's been just being more intentional and genuine about relationship building, letting them know from the beginning that we serve the family as a whole. Yes, we have Focus Mom and Focus Baby, but we serve the family as a whole. We know that building a stronger family is building a stronger community. So we say that from the beginning. Definitely building that relationship is important, and including them and, telling them, oh yeah, you can sit down, we could be a part of this, and including them in everything. Activities we bring out are for the whole family, other kids, whoever's there. So I think just having, I think we have a very mission-driven staff, and we're very intentional about what we're doing in the community. We see the need, and we are doing everything we can to address it and to work alongside other agencies to make sure that we're impacting the community in a positive direction.
And let's talk about intake and registration. So when they come to the program, is it the mom's intake and registration and the dad is separately, or do you do it together? Or after hearing some of the information today, are you thinking about doing anything separately?
So the Edinburgh, we will start doing that separately. So right now we have only been doing it with the mom, but we will start doing that with the dad. And then intake is whichever parent is presenting. So it may not even be the mom or the dad. Sometimes it could be a grandparent. So with us, our primary focus has never really been just the mom. So it's whoever is coming into the door at the time of the intake, and we'll do all of the assessments based off of that person, the primary caregiver.
Ours is the same, whoever is referred to us as the initial intake. We usually have, the partner or dad, or even if the intake is with the dad and mom later wants to be enrolled, then we do an intake separately. We do the, EPDS at, intake, and if we have a dad, we do the CPSD, which is another depression scale. So yeah, it's whoever comes in first, but we let the family know that, the partner can absolutely be enrolled in the program, but enrolled or not, they're definitely welcome at every visit.
One last thing I would like to say is if the parents are not together and they both could benefit from services, so they could both have services. We can service the mom and we can also service the dad, and they don't have to be with the same worker, so they can have their own worker working on the goals.
Okay, any other questions from the audience? Lisa? Okay.
I'm not sure if this is really a question, but just kind of some comments to consider. First of all, Keisha, thank you so much for recognizing the father figures. I think I have been so focused on this, and I know everybody is like shaking their head, but it wasn't until you said that of like recognizing the dads that may not be biological dads, but are involved in children's lives, because I think they also go unseen. But also are adapting to a lot of these changes as well too. So I appreciate you setting that in my mind as well. Many people in the room know I can't be here without like mentioning, I know we don't have an in-person support group here locally, but Postpartum Support International does have an online support group specifically for dads, but that's another resource as well too, to just kind of like consider.
Thank you. And Lisa has it.
Thank you so much. You all did a great job. Having participated in the Ember class and support group, I was surprised that you had dads participating. And what really struck me was the conversation was different than what I expected, and it was richer, I mean, I've been in settings in clinical spaces where we do a lot of talking about dads and about relationship and communication, so that women can get the needs met better, their needs met better. But to have the dads in the room asking questions and talking about, what they can do differently, that just really left an impression on me of, why it is important to have the dads in the room and to hear what their concerns are, and to give them a chance, to speak from their perspective. So it's not so much a question, it's just an observation. And I think, kind of tied in with what Dr. Garfield was saying, is we need to be thinking, that the conversation may look different, may feel different, but may be a richer conversation because of it.
Yeah, absolutely. Okay, any other questions?
Okay, I'm just gonna say one thing. So it goes off of what both of you were saying, and I wish I could take credit for thinking about the dads, but it actually was a conversation that I had with my husband after we had our first kid. And he kind of casually came about it one day, but he was like, I don't want to complain, but when you go to the OB visits, like the doctor is talking to mom and dad is just sitting there. Say in hospital discharge, everything is focused on mom, and dad is kind of the secondary parent, not looked at as a parent specifically. It's just more so like this is mom's support. And he mentioned that I became a dad at the same time you became a mom, but no one asked the dad how they feel with the transition and what do they need to do and how they can process all of those things. How she mentioned that employment is a lot of times what the dad is asking, because he's feeling more so if I can just be the provider, but not necessarily he's not getting a lot of support in the other, like, do you know about child brain development? Do you know about all these other things? And so it was kind of like a light bulb moment, almost that, okay, we don't involve dads the way that we need to, and taking that into account so that the child can have both parents that are aware. And also for the mom, that becomes kind of a slight bit of a burden lifted as well, because moms are always looked at as, you're the primary parent, you have to be superwoman. And it's like, no, baby has two parents. And so if we put both of them, then they can also kind of share that responsibility, and it's not as much of a weight. So it helps the whole family.
Great, great.
Okay, are we going to the next one?
Okay.
All right.
Township is up next.
Panel organizations that successfully engage men and fathers. We'll have 3 speakers today. The first speaker was going to be Daniel Marshall, Arts and Entertainment Program Coordinator at the MLK Dream Center. Previously a advocate at the St. Joseph County WIC, founder of Fathers First, a nonprofit. Danny Marshall is a native of South Bend, a single father who utilizes his influence through fatherhood initiatives, radio personality, and recently received the 40 Under 40 award by using music through philanthropy, helping families in need during the pandemic. So we want to welcome Danny to the panel. So next we have Deacon James Summer. He's a board member of the Men's Talk. Reverend Deacon James Summers is the owner of the Summers Group LLC, revitalizes communities through entrepreneurship and strong business practices. While serving as deacon at St. John the Baptist Church and School, ordained in 2023, he actively participates on the board of Men's Talk, Notre Dame's Federal Credit Union, WNIT, and various boards and organizations, promoting Catholic social teaching, interdenominational collaboration, and community uplift. Welcome, James. And next we have James Gunter. So the second James, we have James Gunter, co-founder and executive director of Present Pillars. Is the co-founder and the executive director of Present Pillars Foundation in Benton Harbor, Michigan. He was recently named to the Moody on the Market 40 Under 40 class in 2025 for his leadership in empowering fathers and advocating for families. In 2025, he played a key role in securing a resolution in the Michigan House of Representatives declaring the week preceding Father's Day as Dad's Week throughout the state of Michigan. Under his leadership, Present Pillars has submitted over 500 expungement applications, helping individuals remove barriers and reclaim opportunity. James is a devoted father, proudly raising Lennox and JJ in partnership with his fiancee Queen. Thank you guys all for coming to me on the panel floor. Well, first up, we have Danny, and Danny's going to come and share about his program.
We all got Bible days. All right, well, I'm gonna pick it up a notch. It's been a little too quiet. How y'all doing? Y'all good? I'm a DJ too, so I'm loud. So I think the reason why, well, I know the reason why I'm here. Go ahead and start timing me too. I don't want to talk to you. The reason why I'm here is because 16 years ago, I was unnoticed. I'll never forget, the mom said she was pregnant. And what made me mad is that I was going through just as much stuff for 9 months as she was, even though I wasn't carrying the child. Like the stress, the happiness, the things like that. I even, we even did a dare on trying a prenatal pill. I was doing so much stuff. And when it did happen for those 3 days at the hospital, I will never forget. I was so excited, and it'll be like, "Oh, hey, the mom's here." I'm in my head like, "I'm here too," but okay. Hey, mom, we're gonna do the jaundice test. Hey, mom, we're gonna do the listening test. I'm like, I can listen to. So I'm looking on the phone like, okay, what is jaundice? Oh, 1 out of everything. What is the listening test? What is the skin to skin test? I'm literally sitting there for 3 days And I'm just like, so this at Memorial. So I'm like, you know, we gonna get you some Subway or, you know, I'm just sitting there because I was overlooked and they kept looking at the mom. Every time a visitor came, oh, the mom, here, let me, and I'm just like, all right, so I could have worked. I could have, you know, I took PTO hours for this, but I'm just here, just chilling. And I think that's why I'm here because why? It made me mad. But instead of being mad and reacting in an angry way, I said, how can I flip this energy? And so ever since then, there was several things that I had to do. Not that I mean I had to do it, you know, and I had to, you know, from that moment on, I realized that I'm a single father. Well, I'm a father and I got to do something about it. So in 2015, you know, I speak the story of 2015, me and two other founders founded, you know, Fathers First. And I didn't even know what to do at first, but I just knew engaging was important. And so I was, you know, I'm a DJ, so I will never forget. There's a place right down the street used to be called Club Fever. And I was like, if I could get 500 people to lift their hands up, and they do, you know, throw their money up, twerk or anything like that, I can get 500 days the next day to say, hey, let's go do something with our kids. And that's what they did. We had picnics, we had ways to engage that was free. If it wasn't not discounted, it had to be free because if there's anything, and with the help of social media, people like to be seen. People like you to see what they're doing. They want you to see how, even though they're baby turn one, it's it's a whole bluey party. Everything is blue. Like they want to show you that. And so I kind of use that you know that structure and the influence of that, how to do that. So, you know, the Father's First program ran its course. And then after that, you know, you can't get away from it. I'm still his dad. And, you know, shout out to, you know, to Deacon and Beacon Community Impact because I did dad's classes. And so I joined the prenatal world, you know, and so it was a little strange at first to people, but we made it work. And then, believe it or not, of all places, I was at WIC. So yeah, I was the dad at WIC. And I would joke and say, one day I'm gonna make this called MIC, you know, men, infant, and children. You know? And so I was the dad advocate, which means I still was a clinical assistant, but it was the focus on the dads. And so, you know, just like a short spill, like of who I am. I got a Be Alive grant uh, through uh, through the city of South Bend, and I made sure that you know it was just a little bit of money, but I made it stretch, and we did Fathers First 2.0. The Space Jam movie, you know, part two came out, and we literally rented out a whole theater and had 100 dads in there. So like you could never get away from it. Is there a current program? Not right now, but no matter where I am, there's always a dad. There's a dad that popped in at my job at the Dream Center because I work with families still. And so it's a passion that's not going to leave. It's a passion that's always going to be here. Just a couple things. If I was rich and had money, you know, I would make sure there was a daddy store in town. You know, I mean, I love the babe store and everything about the babe store, but what would a daddy store look like? You know, it's you know, like would it have barbers? You know, drop it in. You know, would it have donuts? Would it have you know those type of things that fathers like? If I could write a book, I would write a book called The Battle Is Not Yours because I used to be that battle dad in the early stages of my daughter, battling with the other parent. I need this and this and that. And at the end of the day, the battle is not mine. It was affecting the child. And I didn't realize that back in the day. Also, if I was rich, I would probably have vouchers, daddy vouchers, you know, like because when I was in the younger stages, it was so hard to get the child in daycare for the time that I held. It was even hard for them to recognize, and I had to go through extra ropes, extra things, just because I was a single father. It didn't look as easy for me to walk in here and say, hey, I got custody. Okay, we're gonna help this mom first, but then we'll get to you. Then they get to me. You sure you got this, you got that, you got this, you got that? I'm like, look, Mom, did they ask you all that? No, they didn't. You know, like things like that. So, I would do several things. Uber, a dad's Uber, on the way to a doctor, saying that dad is hungry. Uber Eats, who knows? But, what I'm saying is there is so many things that can be done. And I like symposiums like this because I think after today, and even with our doctor here, there's so many things that are currently being done, and there's so many more things to do. So thank you.
So next, we'd like to bring up to the stage Deacon Summers. Welcome to the stage, Deacon.
Okay, that's a tough act to follow. That's just not even gonna tell you. I'm Deacon James Summers. I am on the board of Men's Talk. After a career in marketing I was brought into the community by Whirlpool. I spent like 45 years in corporate marketing and consulting and that sort of thing. So I was doing for the last probably 20 years, helping small businesses with strategic plans and just a variety of ways of putting the business plan together and everything like that. The reason I'm telling you that is because one day this gentleman came in, his name is Levi Lewis, and he was talking and he wanted some input about a program that he has called Men's Talk. Now, Men's Talk is this amazing program that, how guys, we don't talk to each other about serious stuff. We'll talk about football, we'll talk about basketball, sports, and everything like that, right? But we generally don't have heartfelt conversations about family struggles, the stuff that we have to go through as guys. Men's Talk for over 14 years has done that on a regular basis. Not only that, but they got like about 50 guys that come together, right? Every other weekend, 20 or 30 of them just show up. They sit down together and they have the amazing conversations about life. I'm struggling to be a dad. What do I do? Oh, we got a father over there that turns around and says, yeah, I've been there too. I know exactly how you feel. This is what I experienced and that sort of thing, right? I'm turning around trying to find a job. I've just recently released from years of being incarcerated. I don't know who to talk to. I don't know what to do. I don't know how to deal with the next thing. Well, I got somebody over here that has a conversation with me, right? This is a group that is amazing from the standpoint in terms of the diversity of the men that come on a regular basis, okay? Everything from professors from the universities to deacons to just individuals who are in recovery in different stages and that sort of thing. But the amazing thing is the conversations that are had in terms of relationships. The other thing that happens is on a regular basis, I think it's quarterly or so, they will have family gatherings. So now the families come together, the guys come together with their better halves and their children and enjoy experiences together, coming together in ways that just you don't normally think about. I'm a deacon in the Catholic Church, and the CEO of Catholic Charities contacted me one day, and he basically had been at an event, and an individual who had been recently released came to him and asked for support and help and information, and he did not know where to go. He had no idea, and so he calls me. He says, "Deacon James, it's like I have a person here who needs this kind of help." And I've been calling around. I can't find. Is there any organization? I can't believe there's no organization that helps men in this situation that this guy is in. And I'm like, well, here's one. It's called Men's Talk. And I turned around and I immediately connected. And that individual got connected to the organization, was able to help with the help of other men in the group, able to help find a job, was able to help find a place to live, and to be able to be surrounded by people who knew exactly what he was going through and could talk to him in a way that he would understand in terms of how he could be putting his life back together. I am totally blown away by what I've been involved with. So I got involved with Levi because one of the things I would do is help people put together strategic plans. And I started thinking, we started talking together in terms of, one, I can't believe that you've had this organization for all of these years and I've never heard of it. Two, look at all of the different things that you are doing and you continue to build it. But part of it becomes a matter of, it's like, we need to help the community know what the value is and what the return on the investment basically is. I'm just a capitalist here, obviously. The key becomes letting the community understand that programs like this change the community in ways that we fail to measure. If we measured it the right way, if we saw the positive financial impact that it has on the community, then we would be turning around and getting funding and supporting for all of these programs. I'm ashamed to say that I'm not familiar with the gentleman's programs over here, right? But I can think in terms of how we can collaborate and come together and just work to pull these things together. Now, I mentioned earlier that the families come together. The cool thing is that now with Men's Talk, you have fathers coming in and bringing their kids with them. They'll come to the meeting. They'll break out in separate talking sessions. They have facilitators. Men's Talk actually trains facilitators to be able to speak with the groups, coach other men, and develop these skills that they're going. I believe though these are skills that develop into peer counselors. And these would be individual career opportunities. Think about this. If I turned around and I've had some difficult experiences in my life, but I've learned some things from it, and I've learned how to be able to get past it, and I've learned how to be able to coach other people in terms of being able to do it. Now, the situations that I had in the past become the ability for me to be able to have a career and a future helping other people to avoid the steps that I failed at. I think that's a beautiful opportunity. And I think it's one of the things that we need to be concentrating on and thinking very seriously about how we do this. When you can turn around and you can get guys to talk about things that we just normally don't talk about. My wife and I have been married for 50 years. And they said, I say yes, dear, a lot. But the key that comes is that there are so many things that I wish I had known in the earlier stages when my kids were coming up. I wish I had had conversations with some of the guys that were going through some of the things that I was going through in terms of struggling, in terms of trying to figure out how to put different things together. I honestly will admit that I wish I had spent more time with my kids and less time working and trying to make money in terms of trying to build, be the great providers and recognize the importance of being able to listen and understand, one, what my wife was going through in terms of with the kids. Two, more conversations with my son in terms of the challenges that he was having and thinking more about those sorts of things. That's what I see every time I go and I sit down with the folks at Men's Talk. That's what's happening there. I think it's an amazing program, and I'm just excited to be able to share that information with you and the community. Thank you very much.
And last but not least, we have James Gunter.
Good morning, everyone. Good morning. Start with the statement. Those closest to the problem are closest to the solution. That is a principle I learned from a therapist. So my fatherhood story, let me back a little bit. My fatherhood story started during the pandemic. I had actually moved here to work at OC Carmichael Boys and Girls Club, and my fiance girlfriend at the time called me and said, well, hey, I'm pregnant. So I moved back to Florida, and my daughter was born April of 2020. Throughout that whole ordeal, I just kept on reminding myself, like, hey, you can do this, right? It's not that bad. But the normal fatherhood journey, even without the pandemic, is crazy, right? I myself grew up with my dad, never known a moment of life without him. And I thought that I was completely prepared for this, right? So then you get into it and then this can go wrong. Like our doctors were telling her, hey, if she gets COVID, like this will happen. Like it was just terrifying, right? So moving forward, I wasn't having the best time economically in Florida, so I decided to move back here, close to home. So we came back here 2021. When I got back, I worked at the health department for the MHAM program. MHAM is the Michigan Pregnancy, Parenting, and Prevention Program. Don't quote me on that. Because we said MHAM, but so I got to work there, and I became more curious as I worked more with young dads. I became more curious, like, well, how is this system working for dads? Because now I'm seeing all the barriers. So I ended up transferring to Friend of the Court. That's our child support enforcement in Michigan. So with Friend of the Court, now I'm seeing like, wow, this is what everyone was talking about. So it just pushed me more and more into finding ways to advocate for dads and for dads to have what they needed on the front end, so that when they were in the thick of their fatherhood journey, they're not playing from behind. So moving forward, President Pillage was actually founded July 6th of 2021. So we're about 4 years old now. Myself and my co-founder, John Sams, we were just sitting on his couch one day and we decided that there aren't enough stories out there, or there aren't enough platforms where dads can tell their story freely, control their own narrative. So we started a podcast. That podcast, I want to say we featured 13 different dads and it took off like wildfire. Because in our community, this is never like no one has ever said, hey dad, hey man, how can we help? So after the podcast was successful, we decided that hey, maybe we should incorporate and make this a nonprofit. In that process, I learned that there are organizations just like ours all over Michigan. So I joined what's called the MAPFI Council, Michigan Action Plan for Fatherhood Involvement, which was started by the Michigan Supreme Court. So in this journey, we began doing programming a lot like what Daniel was talking about, where we called it free fatherhood links, where dads can come get pictures of their kids free of charge, because we noticed that a lot of dads didn't have even a picture with their children, or children didn't have a picture with their dad, especially when dad was not in the home. So again, it's picking up speed. Then last year we actually cut ribbon at our location now. We call it the Pillar Center, downtown Benton Harbor. And what I'm noticing now is fathers in our community have never had a problem being a dad. That's not the issue. They're facing barriers as men that prevent them from showing up the way that they want. Much like Dr. Garfield in his presentation. Sorry, little allergy. But in Dr. Garfield's presentation, I want to say it was 100%. 100% of the dads said that they wanted to be present. So now we're shifting focus. Now we're talking about men's health, right? A man's mental, physical, and financial health primarily, because we operate under the premise that a healthy man has all the tools he needs to be a great dad, and that he wants to show up in this way. So I started to learn more about community health work. Everybody wave at Isaiah. Isaiah wave back. Isaiah is our first community health worker. And as I learned more about social determinants, I'm like, what, this is the direction we need to go in. So now we struggled at first because I lived in Florida for 13 years, and coming back home is like, okay, well, who's this guy? So that was an advocacy for some people. Other people were very supportive. But in that, I noticed that I had an engagement issue. So when we talk about engaging fathers, there are things that dads like to do already, right? You mentioned earlier those surface level conversations that I call, like we were talking about LeBron and women, right? But when you begin to get below the surface, you notice that, well, maybe I'm hiring and you need a job, right? Maybe you're fighting to get custody or whatever the case may be, and we have a resource for that. But if we never get below the surface and we never ask those hard questions and say those magic 3 words, I need help, that journey stops right there, right? It's a missed opportunity. So at the Pillar Center, what men have the opportunity to do is come to a place where you are prioritized. So we focus on the man behind the dad. Because the dad can focus on the dad, right? If there's capacity building we need to do that is father specific, we can do that. And just doing the work, so I became a trained doula, just to inform this a little bit more. Just to inform our work a little bit more, and it blew my mind how, wow, you know, it just shines so much light on things we should do. Like, and doula training, they taught us to always teach a person to advocate for themselves. In our work now, we do more things to help a dad advocate for himself, like expunger. In 2 years, we processed over 500 applications. When you have a record, you can find employment as easily. Housing is an issue. You can't even volunteer at your kid's school in some places, right? And that's critical. So clearing barriers like that became our focus. We also have a lot of focus on social cohesion and family cohesion. Because again, when a family is together, whether they are in a relationship or not, I always teach dads to you change the title, you change the boundary, not the title, right? Just because you break up doesn't make you not family, right? You're just not a unit anymore. But you can still be a unit that functions for the benefit of the child. So those family cohesion events, kind of like a family art night, I think it's tomorrow. We partner with other nonprofits so that we're not, mission creeping and going all over the place, because at the end of the day, what we're trying to do is build community by starting with that first unit, which is healthy father, strong family, thriving community. I can talk all day. She hasn't given me my signal yet. Thank you.
So now we're gonna open up for a couple of questions. The first question that we have for the panelists is, why do you think that fathers have been an afterthought when it comes to parenting? If you guys could just take them, that's right. Feel free to jump in.
I think this. Can I first start by saying that moms, especially Black moms, don't get enough. In our community, in Ben Harbor being about 85% African American or Black, we are facing shortages on providers. There are all type. We now have a lot of doulas. At the time, I was one of the first cohorts to take the training, but we had a shortage of everything. So in a lot of ways, if mom is underserved, dad doesn't have a chance. So I wanted to start with that because it's easy to, if this house is on fire and you're spraying water on this house, you can monitor the next house to make sure it doesn't also catch on fire, but that's not your focus. So I think the creation of organizations that are dad focused is critical for dad to feel that support and engagement. Sometimes we have it in our friend circles, but most of the time, our friends don't I could talk to a close friend about things, but it doesn't really get deep, especially when it makes me feel vulnerable. So creating spaces where dads feel safe, where men feel safe, where boys feel safe, really helps. And killing the stigma that, dads don't want to be here or different things like that, because those are the biases that lead to dads being completely ignored. Hopefully that makes sense.
I think a lot of times we've turned around and we've just assumed that guys are okay. And we've always turned around and we've actually been raised to act like we're okay even when we're not. And as a direct result of that, we bury stuff. I know that one of my responsibilities over the last few years was grief ministries. And so when we lose a loved one, when we have, and it was really interesting. I had prison ministry, grief ministry, divorce, annulment, and Stephen ministry. So they kept me busy at St. Mark's. But the common denominator was grief. I had individuals who had been released back into the community, and they were feeling they were suffering because they felt disconnected, because they felt like, sometimes they felt like they had let their family down, they had let other people down, they felt disconnected, but they didn't want to talk about it. And it festers. Same thing, you lose a loved one, you don't want to talk about it because, hey, you got the John Wayne syndrome, you know, I'm tough, I can handle anything, right? And as a direct result, we as a society have kind of not paid attention. Now I think we're starting to get a little more focus in terms on the need for mental health with men. I think we're finally getting to the place where we're starting to recognize that we've got individuals who haven't been talked to and haven't been given the opportunity to share how they really feel, what's really troubling them, and therefore not necessarily getting the best guidance and advice. A lot of times we'll turn around and we'll have a conversation with a good friend or something like that, who is completely unqualified to be giving us good advice, right? And so I think that's one of the biggest challenges. And I'm hoping that now we're starting to realize that need and starting to kind of build a foundation, a structure where we'll have more conversations and encourage men to have more conversations with each other.
To answer that question, I think one of the main factors is the society's norms. And so, like, my fuel has always been to change, try my hardest to change the society's norms. And so when you think about the word society's norms, like norm means something is normal. But this is what is normal, not in real life, but normal to society. Like, as far as saying the society say, you're supposed to be tough because of this reason. The society is saying you can tell your son that you love him once he is a teenager, you know, those type of things like that. That's probably the main reason. And an example just came to my head, and I'm not gonna tell the person, but I have an old boss in here, and I love my whole staff. And this is a good example, not about the boss, but there was a desk that came to WIC, and it needed to be put together. And I know she's laughing right now because, you know, I'm the only guy there, but I couldn't put it together. You know, and you know, the first response of anybody like, you're the man, you're supposed to be able to know how to put it together. I'm hardware illiterate, you know. Now I got my dad issues and my excuses. I didn't have my dad to show me how to do something, but that's even a stigma or society's norm. So I didn't know how to put it together, and it was awesome seeing ladies put this desk together. They put several together, but I didn't know how to do it. That's a society's norm to say you're supposed to know how, you know. So that, you know, like, to answer your question, like, there's several out in the world, even beyond fatherhood and what a dad is supposed to be, what are two parents supposed to be, and even a father gets that from the mom. You're supposed to, you know, I was the best dad in the world until I broke up with the mom. When I broke up with the mom, I'm not doing this right, this right, this right, this right, that. And not only, and she's telling Facebook, he's not doing this, that, this, right. I'm just like, I'm just trying to do what I know. So yeah, society norms, I think, is a main factor too.
What would you guys say is missing in the services that are being provided in the prenatal and the postnatal periods as it relates to father?
Engagement. When my daughter was born, I didn't talk to anyone. Outside, well, there was a situation where when she came out, the cord was a little wrapped, and I feel like the provider freaked out. I'm like, hey, take it off. But outside of that, I wasn't engaged at all. And I would say when my son was born, it was a lot better because when my daughter was born in Florida, in Daytona Beach, my son was born at Corwell in St. Joseph, and they talked to me the whole time. Now, that could be because they know me from Present Pillars, but the level of engagement was really high, right? So, quick story, my son was born Christmas Eve 2022. Yeah, 2022. So we got out the house late. So she was already in labor in the car. We dropped my daughter off at my parents' house and we started traveling towards the hospital. I would say 3/4 of the way there, she took her pants off, and my son, I could see his head. Like, so he was born partially in the car. throughout that whole process, like they're asking questions, like when my daughter was born, like, why are you asking this pregnant lady that's having the baby how to spell her name? I'm right here, like, ask me, right? So throughout the whole process, I'm like, okay, well, this could have been better. Like, she could have been in danger because she's not in her right mind. She's not, you know, she's having a baby. So I think I lost my train of thought. I apologize. Oh yeah, so engagement. Talking to that dad is really important because you don't know what he doesn't know, right? How do we know mom actually heard instructions and things like that? But dad is right here. He's supportive. He's here. He's present, and he can also be a part of that process. So engaging a dad in that process also makes him feel empowered. So like you said, you were Googling stuff and all of that. Like with my son, because I was already in his work, I made it my business to know everything, right? I'd never heard of preeclampsia or any of these things. Like, but when I see, okay, well, as a man, I typically feel like it's my job to protect my family, right? I can't protect my family if I don't understand how. You know what I'm saying? You don't know what you don't know. So that level of engagement is critical. Not just for dad's involvement, but for his ability to help protect his family.
I agree. I got the same answer. I only got one child, but I said, if I ever have another child and then you do a skin to skin, put her on my chest. You know, let me see what's going on. But I got the same answer. So, because I hate to say it, and hopefully it's changed because I would challenge nurses after this. But are we, I had a question for us. We keeping it real today, right?
Yeah.
Y'all sure? They didn't ask about the dad until it was time for me to sign the affidavit.
True.
Third day before discharge. So you're the dad? Yes. You want to sign? Yes. That was the only engagement I got.
Yeah, that's the right answer, engagement, right? But it goes both ways. We've been trained as men to be in the background when it comes to the kids. And the reality of the situation is that now we're starting to realize that we have to be more proactive. We should be more proactive, but we have to give ourselves that permission to do that. We have to speak up. If we're being dissed because, just the norms, society norms basically put us in the background, we have to feel comfortable to be able to step up and put ourselves in the forefront. I'm the dad. I matter. And I'm only learning this now as an old grandpa. So it's one of those key things that we have to change the norms.
Okay.
Can I add to that?
Yes.
I want to echo with Deacon. I always call you Bishop. So my fiance's grandmother is, she's 78 years old now. No, not, don't tell her I told you that. But every time we would go visit, she lives in Miami, and my daughter would cry, or even now when my son cries, she said, even if I'm holding him, I'm closer than Gwen. She says, Gwen, go get the baby, right? So if I pick up the baby, she expects Gwen to take the baby from me, right, to be a mom, right? So I also think there are deeply rooted traditions that also prevent these things from happening too. So I just want to add that in.
I did want to ask, we have another question, but I have a question of my own. You guys, both, most of you guys have had children in St. Joe County or in this region of the world. Do you think that it might have been different in another area of the country? And I know when I gave birth, I was in California, and throughout the whole process from like the last classes and, new baby care classes, all the things, they actively engaged my husband in the process. Do you feel that that is being implemented in this area, or is that an area where we could grow?
I think 16 years ago might be different, but I think, with more of what's been happening since studies, the society does show, what's going on, and things like that. There's a lot more, positions in these, like facilities that are trying to cater and find out, what's going on and things like that. So I think it'll always be better, and I think it'll always evolve. And a lot of places are becoming more diverse, and things like that. So I think it's coming along. So
I'm also optimistic. Our hospital system has done a lot of work. Really, our entire most organizations that deal with fathers in Berrien County are doing the work to ask the questions. And we recently had the director of child support and children's services come to Ben Harbor to ask everyday dads questions, right? So this level of engagement, keep on saying this word, is really important because if I believe you care, right, nobody cares what you know until they know you care. So if I believe you care, I'm more likely to tell you things that can lead to policy changes or, rule changes and things like that. But with the influx of doulas now too, these doulas are really excited about father's engagement. Isaiah's wife was actually a doula. So it's a great pair, right? Community health worker that is father focused and then a doula, right? So opportunities like that, to where the investment is being made to widen the workforce that focuses on fatherhood is also helpful.
as a matter of fact, I know it's coming along, because if it didn't, I wouldn't have had the position I had having the dance class. Because when that first started, it was just an idea from that actual, a department. And it was just a stipend idea. And it turned into dance classes, which turns into more, which also it actually got me too with St. Joe County. So I do change that. It did help because something was out there to say, these dads need attention.
But I think it's important for us to recognize that we have to keep the pressure up. We as a country, we as a world have a tendency to go back to the way things always used to be. And we lose focus really quickly. If we don't keep the pressure up, it won't happen.
All right, we're gonna take a couple questions from the audience. We have one gentleman right behind. So if you have a question, then you can come down to the podium.
Struck by the differences in the two panels we just saw. First panel was all working for social services agencies. I imagine they all have degrees in social work, and they're all women. And the next, and also social services, you can't be emotionally involved with the people. You have to have a professional detachment if you're doing your job, right? Next set of panels, all men, definitely the men's talk I'm part of, and I think more about your programs, I'd like to learn more about them, but they're peer-to-peer based. Men don't like being talked down to. We don't talk down to each other at men's talk. We're talking man to man. We're giving advice to each other. You respect it because you're not talking down to me. You can be my friend and also be my peer counselor at the same time. And I think any successful program with men's got to have those components to it. So maybe just have your comments on that.
Yeah, I agree 100%. That was one of the things that I love about Men's Talk itself. The whole thing in terms of the self-respect. I mean, we're really careful in terms of what we don't talk about. We don't get into religion, we don't get into politics, okay? But we do talk about those things that really matter. And I think you're absolutely right that that whole thing in terms of mutual respect is what enables more and more conversations and deeper conversations.
I think you're right. Like you talked about with the whole scenery of that and components of it. I get a lot of advice, but the most advice I received is probably at men's talk, a barbershop, a tailgate, watching a football game. Even though I received that advice everywhere else, for some reason, the level is the same. And so I don't look at, oh, this Deacon, he can tell me, he might tell me something, Deacon's trying to tell me something. He'll tell me something in the barbershop. I'm like, oh yeah, let me get that information. It just hits different.
I think for me, it's realizing that everyone has something to contribute. It's something I've learned from everyone. I have about 9 years on Isaiah, but he's been a dad longer than me, right? So there's wisdom I can get from his experience. There may be things that he seeks from me, right? Experience that I can share with him. So it's always an even exchange of ideas or wisdom or whatever like that.
I like the fact that you recognize the fact that it's not how old you are or how long you've been doing something. We all have something that we can learn from somebody, and if we're open to receive it. Is there any other questions from the audience today? or if you can talk loud.
Well, oh, sorry. I just talk loud. It's interesting. I'm actually coming as a Elkhart County health worker, but I'm also a new mommy married to a new father. But what's interesting is that you spoke on the perspective of culture, and when you said I'm from Mississippi, you probably didn't hear the accent. But when you spoke about being from Florida and your mother-in-law was like, "Well, pick up the baby." That's what you kind of learn also being Black and being from the South. Your husband's like, they tell your husband, you sit down, you watch. So it's interesting to have that conversation of engagement, but also when I'm talking to my new moms and trying to bring in fathers, how do I have that conversation? Because I'm a woman, like, I'm fully girl. I don't know how to talk about basketball. I don't know how to get him to hear, hey, ask this question. So it's interesting you're saying about engagement, but also the cultural, I guess, background and I would say disparity part of it to play into a Spanish speaking or a Black father. How do I have that conversation? Because even my husband and we have that conversation when he's in the room, he's not speak regardless of the not engaging or the not, I guess, what's the word for it? Advocating. That's not his issue, but making sure that his voice is heard. Like my wife, what I say and listening. So I guess I want to hear from that player's perspective.
Like that was thrown at me, right? I would say culturally competent programming is very important. If I am speaking to a group in Benton Harbor, and typically I don't do groups, but Isaiah will be the best person for that. Isaiah is from Benton Harbor. He has deep connections to Benton Harbor. He has cultural similarities to everyone in Benton Harbor. So it's a lot easier for people to accept things when they have relatability. Versus if I was doing something in St. Joe. St. Joe's right across the bridge. It's about 90 or 88% white. Someone from that community will be better suited, right? So, and no matter if it's race, if it's anything, right? Like I said before, those closest to the problem are closest to the solution. So having the right person, the right messenger is always very important. But I feel like as far as the tradition goes, I now am super dad when I'm around grandma, right? Because that also helps her to shift how she sees my role. So, and especially given what I do for a living, I never wanted, and given the fact that Quinn is a stay-at-home mom, when we're on vacation, she's on vacation, right? I'm also on vacation, but I love playing with my kids. So, it's never a problem because I don't feel like I get enough time. Sometimes just random thought. Sometimes I leave before they wake up and I come home after they go to sleep. So I don't love that, but I look at those as opportunities to, catch up on some time. But again, the more we challenge tradition, harmful tradition, the better. Hopefully, I answered your question.
Yeah, I would agree with that, and especially from the standpoint of, I think it's really important right now that we recognize the different perspectives and be aware of them. In my role as a deacon, it's really challenging, especially in the Catholic Church, as being a Black man, and what some people will have in terms of their expectations of how I'm going to interact. And so I have to be very intentional in terms of understanding where someone is going to be coming from, basically what they probably are. And I get the cues from what they say, the terms and that sort of thing, and how to respond to them so that I'm actually heard, so that they don't shut down. And I think that's really important for us overall in community, but especially as we're leading or we're trying to make sure that we're changing people's hearts and minds to take the time to understand where they're coming from. Respect that perspective is based on their life experiences and everything like that. And then give us the chance to be able to communicate where we're coming from, because they won't listen until they feel heard. And then once they feel heard, then they are more likely to hear the different perspectives that I might bring. And I think that's going to be important in any kind of interactions that we have with folks.
I'm kind of piggybacking off of James, well, this second James. My first name, second James. But piggybacking off of him, while I was a dad kid and even with Father's First, I challenged a lot, not just dad, I challenged a lot of parents because that cultural thing is big. You know, the very first time that I told my daughter's mom, I'm gonna have her for like a longer period of time, she looked at me like I went against the granny. I didn't go against you. This is just what I want to try to do. Now, you know, time later. So when you gonna get her, like, yeah, of course, because I showed you I could be the super dad and you know, and all types of things, but even challenging them. I don't think that I am the dad who I am. I didn't break a generational curse of fatherhood until I tried something different. And what I tried different is being in my child's life because I didn't have a father, you know, that was in my life like that. So I challenge a lot of parents to say, hey, try something different. Man. And everybody say, well, the culture is this, the culture is that. But doesn't culture change? You hear people say, hey, this is the new culture of this and that. This is the new culture of this. Or people say, like, the culture of the 90s is definitely different from the culture of the 2000s. You know, that's why we acknowledge it and say, I love the 90s because it is. I love the 2000s because it is. The 2000s. So culture changes. And even as far as with people, culture change. So, and I'm not saying it's easy, but I'll challenge that parent to say, hey, put them in the dad's arms. You sure? Yeah. Let him try it out. You know, after a while, it'll change. So
we'll have one more question for this gentleman over here.
So, James, how can I sign up from South Bend? We need to go to St. Joseph or Benton Harbor to meet over there, or can we join the South Bend?
Well, I would say you can join any way you like. I actually am very interested in seeing how we can collaborate. We're right around the corner. And exposure. Benton Harbor is a very small place with a very small town of mind, right? The more we get out and talk to people that are different, Michigan and Indiana have very different laws and different things like that. So I'm looking for cross-state collaboration. But you're more than welcome to attend anything we have. I can give you our information.
And for other teams also, and you can, how do we, engage? How do we, is there any membership or anything to sign up?
With regard to men's stuff?
And stuff as well as.
Yeah, I've got business cards for all men's stuff, so anyone who's interested. Let's have a conversation right after this and turn around and I can invite you to the next activity that we.
And for you, how do we sign up for the Dream Center?
Oh, the Dream Center?
shameless plug time. 1522 Linden, you can come right now as soon as we leave from here. I will be there. Yes, we got our youth dreamers, which is 22 and down. Then we got our silver dreamers, which is 55 and up, and 23 to 54. There's two parts. There is the community membership where there's limited access, but you still get examples or where you're free. This Saturday, we got yoga and mimosas, all types of things like that. And then also, if you want fitness and rec for 23 to 54, it's 20 a month, the lowest in the city.
Well, I'm signing up this afternoon.
And a very, very short break, and then everybody can return back for our last panel of guests.
So we'd like to welcome to the panel. We have the Adele over here. So just to start, could you tell us a little bit about your family?
Aloha, I am Rich. I have three kids. I have one, my oldest stepson who is 7. My youngest is 1.5, and my first child, Ricky, the fourth is 5.
Hello, my name is Suleiman, what you can call me Yemi. I have a wonderful family. My wife just gave birth to a set of twins, some 3 months ago. And I thank God that they are keeping me busy.
And so far, have you felt included and recognized as a key part of the healthcare support system during your work for your see? No.
I would have to say, during the, I experienced the pregnancies, 2 different periods. The first one, I would say, when it was during the pandemic with my first child, I did feel, like it felt very hands off for me. It was very focused on the mother, especially in the pandemic. It was all about keeping her safe from the issues at hand, and that felt I didn't really couldn't put as much effort into caring and learning and educating myself as well as I could have because of those issues. But in the second, my second child, my youngest, I was very much more hands-on. I've noticed that the nurse practitioners and with her gyno visits that we would and her OB/GYN and be with her, I learned a lot more. I learned about ethnicity and more about the procedures and processes that go especially with complications in pregnancies.
Okay, for me, I can say that during the pregnancy, going to an appointment, most of the focus was mainly on the women. Yes, maybe they will ever ask me, how am I feeling? What am I doing? Or the only thing that, hey, how are you doing? Hope the baby's okay. Hi, kid. Because that one made me feel like I see I'm just a support, not a partner in equal. And I'll just wish maybe in the next time I'll try to provide that to make sure that they include the father in whatever decision. Like when the guy was talking about the only time they ask is when you want to sign the certificate. Definitely happened to me too. Yeah, before that, can you come and sign? So I just feel like I see it. We are present in the
I can relate to that. I remember when they would hand the birth certificate to my partner, and they would have them, so they would write out their name, so they would be giving our baby the name. It was so funny to look at their faces when they would ask me the certificate to write down the name, because we're Hawaiian. We have long Hawaiian names and only I can spell. For example, my first kid, his name is Ho'opo Maika'i Ame no Hoku. And for me, and it's very important that the name is made by in this case, the matriarch of our family, which will be my mother, but she gave me the power to name my son, give myself the name.
What is one thing that you wish providers understood about fatherhood?
I wish they understood the stress it takes to, especially if you're going with a complicated pregnancy, the stress and the amount of work it takes to make sure that your child comes in term full and healthy. Dealing with like cases like anemia or preeclampsia or endometriosis, stuff like that. They don't realize like how stressful it is to try to deal with the situation you do not understand. And the education for men is key here.
I wish everybody can understand that the father want to be involved in every decision of the journey. At least they should see them as an equal partner, not just as a support system. Equal partner in every decision. Whenever they are doing anything.
I just feel there's enough resources available that specifically address the emotional and mental health.
I personally feel that there is not enough mental health support systems, or the systems that are in place now are not being as advertised well enough or being brought about through word of mouth well enough. There's a lot of stigmas I've noticed since I've moved to the mainland United States, that I've noticed a lot of stigmas of men and their emotion and not being able to express themselves completely and truly. To be one thing I've noticed is a lot of people would tell me that I'm genuine, which is not a very common trait to people, apparently. So that these support systems need to be less stigmatized so that men can have better answers.
For me, I don't think there's enough mental health issue for the father. Because if you look at in our community, most of the program focus mainly on the women. Maybe out of okay, let's say 100%, maybe 2.5% of it focus on women. Which is not okay. So
I want to add to that, I don't know how many times I had to go through a bunch of red tape just to get my son's WIC card fulfilled or checked up on. It's there needs to be better systems in place for men, for sure.
even during the pregnancy, most of the women, okay, right now, I'm at home with my wife. I'm the one that know whatever she's going through, if she's not sleeping, if the woman is all right. No provider, they will never ask you, hey, how are you coping in this situation? They only focus mainly the mother and the child, the mother and the child. I'm the one that actually drive her through and fro to the appointment. They will never ask me, maybe I come back from work or I'm doing something, I have to make sure to meet up the appointment. But they focus on them alone, which is not the right thing to do.
It reminds me of when my first son was born. She was a C-section. I was so scared. I had no one to talk to, no one to be like, hey, I'm feeling this way about this, because I needed to put on that mask of being strong because my partner was going through a C-section. Being that support, solely that support was a lot, to the point where once my son was born and he was safe and I knew he was okay, I was sleeping for 12, 13 hours straight. It's a lot.
And where else did service providers miss opportunities to engage and provide support to you, and what made you feel more confident with father?
For me, I feel like a lot of the providers, they miss opportunities because when they would come at me, with the perspective of a non-Pacific Islander background. So it was a lot of reiterating values that I already had, such as ohana and aloha, just pretty much loving and caring for everyone, because everyone knows the saying, it takes a village to raise a child. It's all about who you put in your village. And if you don't put the support systems in yourself as a man, if you don't put those support systems yourself in place, you're out of luck. You're out there drowning, no boat, no life preserver, and you gotta figure out how to swim.
So for me, the provider makes the point of including me in the checking in, we should surely talk about how are you doing, but they focus mainly on the mother, which is not right. If something is going on with me right now, I want to be strong, but nobody asks me how am I doing, how am I feeling. throughout the journey, I was there for her because we don't have any support. I'm the only one. I have to go to work, come back, and do everything in the house, make sure she didn't miss an appointment, make sure everything that she has to go. I have to be the one. Why can't they ask me how are you feeling? How are you coping with this? Just focus mainly on her. You know. Even during the session, we went for an appointment for a check-in. Okay, we are going in right now. And I'm just downstairs to go and get something for her. They didn't even bother to wait for me to make a decision whether this or that. So they just said, we are going in right now. She has to come, hey, come back right now. They are saying we are going in. So which is not the right thing to do.
And then the second part of that was, what made you feel more confident entering fatherhood?
What made me feel more confident entering fatherhood was, I have not, well, of course, my number one support system is my fiance. Was having my partner at the time always reaffirm that what I was doing was always for the best, what's best for our child. And that has always been my main motivation, was just to do right by my children. And that alone gave me the confidence to just keep pulling through. Even if I made mistakes, I would have to learn from them and keep trying.
To me, what made me more confident is about the program that we offer at Una Saint, the Strong Father. I was able to talk to different dads that have been in the journey before me because I'm a new father. So with that program, I was able to learn on how to go about everything, which I think, even though it's only one program for men, I expect more of it in the community.
Is there anything else that either of you want to share about your experiences?
For me, I would like to just state that how much of an effect having the values of Ohana and Aloha in my family have. Everyone knows these words. We've all watched Lilo and Stitch and whatnot. When we all know Ohana means family, and family means no one gets left behind or forgotten. And this includes, for me, not just only my biological children, my soon-to-be stepson, Henderson. I love them all so much. And it's through that love and the Ohana, not just the biological, but the chosen Ohana as well, that I have this support system that has my back. If you don't have that support system, especially with therapy or seeing healthy families or any other of the what we've seen from today's panel, the other support systems that are in place for men out there. Without these, you won't be able to be an effective or an overall good parent, as people would say.
To me, being a father has been a challenging and a rewarding stuff for me, and seeing them growing and learning day by day make me happy, because I know quite all right, my labor is not in vain. And then whenever I see them, early in the morning, I'm sure they have even been in the middle of the night, I just look at them, I'll smile. With that, it made me to continue pushing on.
Thank you both for sharing. Does the audience have any questions?
Thank you for sharing. I'm a mother of only boys, so this is helping me set some dreams and visions for my future family. So thank you so much for your wisdom and your insight. But what are some things that services providers or even billboards that were out in the community inspired you or gave you life and motivation or did support you in those early days in your fatherhood journey?
I would say that's a tough question for me because the early days were during the pandemic. So there wasn't a lot of, there was a lot of new focus into mental health awareness then. But I was, one program that really helped for me was, for my oldest son, was a Head Start, an early Head Start. They were great early education programs. They also provided me with a lot of resources in the community for so that I could receive that support as well.
This may be a really quick question. If somebody in the hospital said, here's a depression screen for you, Dad, how would you feel about that?
I would feel seen, to be honest. I have a history of depression and anxiety and other mental illnesses. That for them to be give me one would be kind of like, okay, you see that I'm struggling and you want to see where I'm at. So it feels like I'm being seen and heard rather than being like some person who is not aware of this stigma would kind of be off put by.
For me, it's to just say it's a stigma because I didn't tell you what I'm going through. How do you know that I need this medication? So I'm just why I didn't doing this to me. So that's how I feel.
Thank you.
I have to say thank you as well, because what you guys have shared has been amazing. If you could say one thing to a new dad, what would you say to a new dad?
Just keep moving. If you don't stop, you can't. You gotta take it one day at a time.
Just keep believing and believe in God that with God all things are possible.
If you have one more.
I had a follow-up question from Lisa's question. I'm curious if you would view a screening that was not labeled a depression screening, but rather a stress rating scale. Would you see that as different, less medically aimed and more at your personal experience?
I feel that would be a more accurate gauge of what would a man would be going through, especially during a pregnancy, rather than just depression. Stress itself, because depression itself could be caused by stress. So if we were to focus on tackling the source rather than the symptom, we might be able to make some progress.
Were you gonna say more?
Yes, I can call the team.
So part of my thinking was a scale like that could be responded to with education and support resources rather than aiming for a next medical diagnosis. It could be just focused on support more than anything. So thank you.
Yeah, knowledge is power.
I understand that most men would view that as an insult or saying, hey, what do you think? Is something wrong with me? They're gonna be defensive about it.
The stress.
Either one, you're better off giving them a pamphlet, letting them read the information. They gotta breathe the one that initiated. They read it, they'll come and ask for help. But if you kind of do that, it's gonna seem condescending. And most guys are defensive. They're gonna say, I'm strong. What do you think there's something wrong with me? First to be thinking, that was a hard thing to challenge, but I think that's how new babies get some sleep, get a lot of sleep. It's my recommendation as a new father.
Yeah.
You will not get sleep and it's
That's true. Those 12 hours after the first week, most of them are gotten.
I'm from the educational environment, and so I just wanted to get your feedback from fathers with regards to their children's education. Do you feel like you are involved? Are you being heard? What would you like to see the educational environment be different to engage fathers?
Are we framing this from the perspective of home or in the school? So,
In the school, but if something is affiliated with something that relates to education, that's fine too.
okay, so within the school, I feel like there could be more activities that pertain more to fathers and their children. What could I say? Like you guys said, there's father-daughter dances, father-son field days, some things like that. Just for just more opportunities for fathers to get involved in their children's education. Is always better in my opinion.
I just want to clarify, or piggyback off of her question, I too, work for Southwood, work for Southwood School. And I do know that there are a lot of resources and things that are happening, in the community for family. And to Sheriff, are you saying that, it needs to be specifically geared toward fatherhood or involvement in terms of when we advertise or the whole marketing piece? Because I do know that there are a lot of activities happening for families in St. Joe County and beyond.
As well as to not alienate the rest of the family, I would say that you are there, you are right there. There are lots of things going on in South Bend, but it's just a matter of trying to find ways to make fathers want to be engaged in those things. I personally, not being new to the area, I don't really know what gets men around here engaged the best, but I do see from my observations, it seems sports and other especially because this is a Notre Dame centric area, so sports tends to be like the #1 most engaging thing for men in this area.
So my second part to that question is, what, in your opinion, would be the best way to get information out to the masses?
Well, this is in the age of the internet, so I would say like social media would be good. A lot word of mouth is also good for men. Lots of networking is usually a lot of like gym talk and stuff like that, or barbershop talk, and you're just talking. It's not what we call talking story, but also in the process of learning and educating ourselves as well.
Thank you.
Yeah.
Any more questions? I can be loud enough. Is this loud enough? Yeah. Okay, okay. What inspired you both to be on a panel today?
What inspired me was the opportunity, just to have the opportunity to be heard and to give to not just give the father's perspective, but also the perspective of Pacific Islander. Looking around this room, I presume I'm the only Pacific Islander in this room. So, just to have that to be the vocal minority, to represent my group, was an inspiration in and of itself.
Okay, what inspired me is to share my story so that the new father can understand that to be a father is not something that you just take it for granted. You have to appreciate every step you're going through.
As first-time fathers, when you guys were first-time fathers, is there a prenatal class that you would have loved to be involved in? And if so, what kind of class would it have been?
I wish there was a class that prepared me for my first son. He was a formula baby. Something that would have prepared me better for the responsibilities that come with a formula, that come with having a baby that's brought up with on formula because of complications with breastfeeding and whatnot. That education in that regard would have been very helpful.
Thank you.
To me, education in that aspect would be helpful for me if I was involved in every decision they are planning. Maybe, take for instance, right now, we are talking about the prenatal. Any prenatal engagement should be between both parents. That is,
both parties, not only one person that they focus on. So with that, we'll be able to, and if you want to bring out a father to attend a program, go through the woman. Definitely he or she will be able to bring him there.
More questions? I just have one more thing that I wanted to add. And again, this is something my husband kind of had me realize a long time ago with our first kid, is that we ask the questions, how can we support them, right? And now that they've shared their answers, we have to make sure we actually are hearing them, not asking them to say, well, I asked them, we checked off the box. So our challenge now is, what are we going to do with it? Also, one of them mentioned that what gave him the confidence in fatherhood was that support person backing him. And I know, speaking as a mom, I'm a boy mom as well, I have 3 boys. It's giving them that chance to do the fatherly things. Sometimes as moms, we want to take over. We don't like the way the guys do the channel. We don't like the outfit that they picked out. All of the things, but also in empowering the dads, we have to let them be dads without the criticism. And so I want to make sure that not speaking for the dads, but just speaking with someone who interacts with the dad. The more I stepped back, the more he stepped forward. And so there are some women who may be scared to leave the baby with the dad. Like, oh, he's babysitting. He's not babysitting. That's his child. That's parenting. And so letting dad do it his way, as long as the baby is not being harmed, letting them figure out how they parent and giving them that space. So that's cool.
Just briefly, I am a clinical mental health counselor. And in my experience, I find doing couples counseling, if I engage the fathers and bring them in and say, what has been your perspective? What was your idea of fatherhood and marriage and all that? My question is, do you guys feel that has been spoken? Do you think that you would have benefited from having like a family counseling or couples counseling, just to get your perspective on what a man's idea of being a father is? So you can have that platform where you can be heard, and then you can kind of initiate those things that are important to you as a man in your family, and also including your wife, making everyone inclusive. Do you think that would be helpful going forward?
Yes.
Yes, I am a devout believer in therapy works as long as you can find the right therapist for you.
I agree.
You can make boundless progress with the right therapist and counseling for sure.
Thank you.
I was thinking about your question, how to get men involved, maybe like at a Lamaze class, you spend 20 minutes, say, hey, the girl's gonna go here, and the guy's gonna go here. And you get a peer, like a father, not an expert, some, guys, this is what's gonna happen. Your wife's not gonna have sex with you for 3 months. It doesn't mean she doesn't like you. You're not gonna get any sleep. You're gonna be crabby. It's not because you don't like each other, it's just because you're not getting any sleep. Peer to peer, talk about that kind of stuff. And then, yeah, okay, here's a pamphlet and some programs if you really feel something. Maybe something like that. It stresses that peer to peer.
I love that.
Not the expert. Lamaze class, everybody's going to it, but you can just go 20 minutes. Maybe something like that would be a good way to get guys involved.
Thank you. That's a great idea. Absolutely.
Any more questions or comments? All righty, we'd like to thank our panelists.
Well, what a great day. We want to thank all of you for attending our 2025 MHAM Perinatal Symposium. We want to thank our partners, our sponsors, our keynote, and all those that have participated. Let's give everybody a My job is to encourage you to please do the evaluation. We value your feedback and your comments. Don't dock us on the room being cold. I try to get it warm. Yes, I tried. I asked twice.
So you don't have to put that in the comments. I got you. Anything else? We would love for your comments. We do have an incentive. If you do the evaluation, before 5 o'clock today, you'll be entered into a drawing for a gift card. So please, please, please do the evaluation. Please stop at our, partner resource tables. Evaluation is on the back of the program. We want to thank our sponsor, Anthem. And we do anthems out there on the table, have the table full of resources. So we want you to stop by our resource table and pick up some free resources. And we also want you to stop by the MHAM table and pick up our next class that we're offering is on Friday, September 26th. Is suicide risk assessment and management during pregnancy and the postpartum period. And it will be on Friday, September 26th at One Roof here in South Bend. So we have flyers on our MHAM table. Please pick those up and other information that we have. Again, we want to thank everybody for coming and hope you have a nice afternoon.